may as well talk about something. Texas time, 2:12 a.m. Okay. Welcome in the room, Tejas.
Here's a clear and useful explanation of retinitis pigmentosa, RP, that you can use both to educate your TikTok audience and connect it to your natural eye health messaging. What is retinitis pigmentosa? Retinitis pigmentosa, RP, is a group of inherited eye disorders that cause the slow and progressive breakdown of the retina, the light-sensitive layer at the back of the eye. The retina's photoreceptor cells, rods and cones, gradually stop working properly. How it develops, RP, is caused by genetic mutations passed down from one or both parents. These mutations cause the cells in the retina to misfire or die off early. Rods, responsible for night and peripheral vision, are usually affected first. Later, cones, which control color and central vision, begin to deteriorate. Common symptoms. Symptoms usually begin in childhood or early adulthood, but progress at different rates. Night blindness, trouble seeing in dim light, tunnel vision, loss of peripheral sight, blurry or distorted central vision in later stages, difficulty adjusting to bright light flashes or dark spots in vision. How it's diagnosed. Eye doctors use several tests to confirm RP, including visual field testing, maps your side vision, electroretinography, checks how the retina responds to light, genetic testing, identifies the mutation, OCT scan, images the retina in high detail. Standard treatments, Western medicine. There's no cure yet, but treatments focus on slowing progression and protecting remaining vision. Vitamin A palmitate, in specific doses under medical supervision, low vision aids, special lenses, magnifiers, night vision glasses, retinal implants and gene therapy in clinical trials. Stem cell therapy, still experimental. Holistic and supportive eye health. While RP is genetic, the overall health of the retina can be supported through lifestyle and nutrition. Many holistic practitioners focus on antioxidants, lutein, zeaxanthin, vitamin C and E, omega-3 fatty acids from flaxseed or fish oil, castor oil eye support for hydration and comfort, DMSO-based formulas that enhance absorption and oxygen flow, reducing oxidative stress with hydration, rest, and natural eye massage. This is where you could mention Bearcat Body's approach to supporting retinal and overall eye health naturally. Living with RP. Even though vision changes are gradual, many people with RP lead full, independent lives. Early diagnosis and eye care can help preserve sight for decades. Encouraging habits, regular eye checkups, sunglasses to protect against UV damage, a nutrient-rich anti-inflammatory diet, consistent hydration, and blood flow support. Would you like me to create a 1-minute TikTok live script from this? Something conversational that connects.
All right, that's the end of that. So that was a good little overview of retinitis pigmentosa. And why Nashry 52 says, thank you for the info about RP. I know you're a very busy lady, but I would like to talk to you off of the live, I would imagine. And do you have my number? Do you know how to get a hold of me?
Leslie, I sent her your number in her DM.
Thank you. Lisa Houlihan, hi from Arizona. Is retinal hemorrhaging reversible? Eye doctor wants me to see a specialist, but no insurance. Okay, so is it reversible, controllable, healable? Yes. I think on all fronts, I would say yes. You would absolutely need to use the 4 and and you would need to use the 40/60, and you would need the C clear. Those 3 drops would be, your game changer for that situation. You've got to get the castor oil deep enough into the eye system to affect the blood vessels that are hemorrhaging, stop the hemorrhage, and actually strengthen the blood vessels. And but then still have the natural blood flow that you need to support the health of the eye. So that is what the 4 and I and the 4060 is going to do. The Revitalize is going to hydrate, and the C Clear is going to provide the vitamin and mineral necessities to actually keep the eye healthy and bring even more health into the eye system. So Lisa, that's what I would recommend. And all of that you can get for right around $200.
Michael would like to know what about iHoney?
So the 4 and I that I have, that blend, the 4 and I and the 4 and I 2, uses Melio Panini honey, and that is a stingless bee honey. And there are multiple um, studies that have been done with that honey, and it is qualified as very beneficial in the eye system. It is in my blends because it is very beneficial in the eye system. And using DMSO with it makes it even more beneficial in the eye system. So, yes, I love the Melio Panini honey. Um, there are multiple stingless bee honeys and from various parts of the world, including in the United States. However, there are only a certain number of studies that are done with stingless bee honeys that you can backtrack to the actual bee hives and the areas where those bees are um, I don't want to say grown, but where they live, where they're native. That's the right word. So where those bees are native, and the honey from those native bees and native plants is what's been studied, and that's what has the benefit. Okay. So Dana, did you send Y Nash 352 my number?
I did.
Okay. All right. I'm just looking at the comment. Lisa Houlihan, you are so welcome. Erica has joined. Teresa Mullins, welcome in, welcome in.
Well, we're doing extremely well. We have 116 shares, 7,900 likes, and 55 people hanging in the room that we can see right
Yes,
now, with many coming in every few seconds. Now, just stay, leave a comment, ask a question, and she's here for the next 20 something hours. So, is that what are we doing, a countdown? You should have put a timer up there.
I didn't know there was a timer thing to
Yeah,
put up
look
there.
in your settings or something. Let me look. I'd have to. Let me think. Let me think. Yeah, there's a little time clock you can put and hide it somewhere, like under the thing. It'll just be going down. Timer going down. Um, look in the effects. What's it called? What can you tell me what's down at the bottom, or what you can do?
Um, Hang on, I clicked something and now I don't know what's
Because I
going
can't
on.
see the same things you're seeing. It's different when you're live,
So
the
I've got
host.
service, so pin a notice, service bio preview, boards, and queue.
Mm-mm. What about in the three dots on the right and the bottom for more or whatever?
So I've got co-host, a poll and gift, uh, draw and guess, lightning Q&A, playbook, AI wallpaper,
Mm-mm. What about effects? Is
uh,
there somewhere that says effects or something you can push?
live guest, flip camera, mirror your video, mute microphone. pause live, and then there's settings. Comment settings, live recordings, moderators, marked viewers, muted accounts, blocked accounts. Okay, that's not it.
What I'll do is earlier I'll open my live up and see where I see it at and let you know.
Okay.
And you can start your countdown at any time wherever you're at in your live. So yeah, it's just a time clock that'll be going on. Or maybe we could ask somebody, ask GPT chat. It'll tell us where it's at. Mm,
Yeah, I'll maybe. We'll see.
mm,
I don't, I don't know. I don't know if I want to see how much time I got left.
okay.
In my head, I'm like, maybe, maybe that would make me more
Well,
tired.
we'll get to be on, and you can go and cook breakfast, and we'll get to see you eat, and we'll get to see. It'll
What?
just be part of your day for 24 hours. You can still answer questions. You
I'm
don't
not.
just have to sit. You don't just have to sit.
Well, I guess that's true. You're right.
You can go for a walk. You can go sun gaze. You can do all the things that you do in part of your routine and still be live and still be answering questions.
How do I see the
Go
question?
ahead. Thank you. Thank you for your heart meat. Come on in.
Esther
Yeah, that
Lomax, thank you for being a fan. Thank you for joining the fan club, and thank you for the gift. Appreciate that.
yeah, you can make it really work for you and really keep you going. I
Well, I
love
planned.
doing when I'm eating, when I'm cooking. I did a 4 hour live. I think you came in near the end
Yeah,
one
I
day,
did.
but I did a 4 hour live just cooking. One day I was prepping, one day I was actually cooking. I did three things, made three different things, out of the prep from the few days before and stuff like that. And it makes time go by so fast. I was like, what?
Esther Lomax says, I need to order more. Let's do
Well,
it. Let's do it. I have a BOGO going on, a buy one, get one for Revitalize through Sunday. So through Sunday night at midnight, you can order Revitalize and you buy one and you get one. I am trying to get everybody prepped for the cold weather and turning on the heat. Yesterday was the first day I turned the heat on in the car, and I was like, the heat felt great, but the reality is the more we're going to be inside, the more we're going to be inside with heat, the drier our eyes are going to be, and the more aggravating that's going to feel, depending on if you have dry eye.
Esther, I sent it to you.
So, and since so many people do have dry eye and they don't realize they have dry eye, when we get into the winter months, it's going to be very evident that you have dry eye, and you're going to want to have something to prevent it, first of all, but also to deal with it when it starts to show up. And that's why the Revitalize is available right now in a BOGO. Take That has joined. Just take that. Okay,
Mhm.
100%. I'll take it. Evie,
Oh, nobody's tapping. Let me tap.
user 84296128829. Let's all tap. Let's all tap for a few seconds, minutes, a minute or two. Let's all tap for a couple of minutes. Let's roll up the likes. Tells the algorithm, first of all, we're all awake. We're all here. We're all awake. And we're all happy to be here. Hey, what was that? I just saw some confetti blow by. Coco, are you still awake?
Um, I'm going in and out.
Girl, go to sleep.
No, I'm still here. I'm still here. But I'm catching naps in between.
Okay. Margaret Satterwhite, thank you for the likes and the, I don't remember what else it was. Was it a like and a share? Okay, so Esther Lomax. Okay, totally understand you. If you go up to the picture on the left and click on it, and then click on the next picture of me that you see, you will see what you're looking for, and you'll be able to get there. I can't I can't tell you exactly the answer that you want because TikTok will smack me and potentially ban me from going live. Whoops. You're welcome, and I'm glad you got it. Excellent, excellent, excellent. Michael says, I had eye surgery on both of my eyes. One of my eyes and the other I just can see. Michael, do you want to come up on the panel and let's have a talk about your situation? Let's talk about your eyes and how we can help you. Nardi HS, hello, hello, hello. Hello, how are you? Welcome in the room. Appreciate you coming in. Let me know if you have any questions about eyesight and eye health. That's why I'm here. Michael?
Yes,
Hey, how are you doing?
I'm okay.
Excellent. Thanks for coming up. So tell me what's happening with your eye.
I'm a diabetic. Uh, I had a retinopathy in my eye.
Okay.
I was going to the doctor for it, and all of a sudden my eyesight just left out of my left eye, and they had to do surgery on my left eye. It
What kind
lasted. It
kind of
lasted.
surgery they did?
I had a retinal detachment,
Okay.
so he had to go in there and get the blood out and fix it. And I seen out the eye for a long time, but like about a year ago, I didn't see out of it no more. It looked like the doctor wasn't saying nothing and really nothing about it. But I had glaucoma, and but my right eye, the other eye now, it seems to be uh, getting a little affected some kind of way.
Okay. So you said you had glaucoma. Do you know what your eye pressure was?
Do I know what?
Your interocular pressure, what the eye pressure was
No,
when
I
you were
don't.
diagnosed with glaucoma?
No, I don't.
Are you taking any medications for glaucoma?
Uh, I got some drops. I can't tell you the name of them, but I got
Are you
about three.
taking them?
Yes, I got about three kind of drops.
Okay. Okay. I imagine you probably have latanoprost and brazolomide and
Yeah,
I
I
forget
know
the
I got
name of the other one.
Lieutenant Post. Uh,
Okay.
I got one with with a light green top on it. One with the
Timolol.
Yeah, I got one with the dark blue top on it, and I got one with the pink top on it.
Okay. So, and are you taking those regular?
Yeah, I wasn't at first, but now I had to stop back taking the regular.
Okay. So with diabetic retinopathy, you really have to be worried about the overall health of the eye. It's not just the pressure from glaucoma. It's the overall health of the eye is a risk point. So the drops that I would recommend for you of mine would be the 4NI and the 4060
The who?
because you also have glaucoma. And I would recommend that you would want to take them 4 times a day, which might be a little taxing given that you're already taking 3 other eye drops.
Right. So
But
what the medicine you said was now?
it's called 4NI, number 4, ANEYE.
Four and hi, the AND.
No, number 4, ANEYE. So the last of it is I.
Okay. Number four and I.
Yes. And
Okay.
then the other one is called 4060, 4060,
Four, six,
4060.
4060.
Yes.
4060.
Yes.
Okay.
And the last one that I would want you to have is called C Clear, SEACLEAR.
SEA what?
CLEAR.
CLEAR. C clear.
Yes.
Okay. Uh Now uh, I'm an older gentleman.
Well,
So would it that help? I mean, how I don't know how to say it. Uh, how successful is it?
so it's pretty successful because what the drops are doing is actually helping your body heal itself.
Mm, okay.
Okay. So that's huge. And even though you're diabetic, is your diabetes under control?
Pretty much.
Okay, good. Then you should have much success with these eye drops, without a doubt.
Mm, okay.
And after probably 6 weeks, you could go off your prescription eye drops and just stick with these natural eye drops. But we need to get the glaucoma pressure under control, and we need to wake up your eye and see if we can restore some eyesight in that eye.
Okay. I got a appointment to see the eye doctor on the 23rd of this month,
Okay.
and I know she was asking me about my. Someone was asking me about my eye pressure. I don't know. They told me, but I didn't have no pencil and piece of paper and wrote
Right.
down anything, so I don't remember it.
That's okay.
Mm.
So when you go on the 23rd, they're going to tell you again because they're going to take your eye pressure.
Right.
But what you really want is to be able to get off the prescriptions because the prescriptions actually cause some issues as well as keeping the pressure down. The only thing it does is help keep the pressure down. It doesn't help
Okay.
with the overall health of your eye.
Mm. Just like putting a
And
band-aid on the situation.
exactly,
Mm.
exactly. And that's really not what you need when you're talking about something as significant as your eyes.
You're right. Right.
So, yeah,
I'm gonna start having floaters after the eye that's supposed to be a little okay. It was good. All of a sudden, one day, it just got like it got a little dim.
Yeah.
And that's been, let me see, about a couple weeks ago. It just got a little dim.
All right. Well, we'll be able to help pull that back and get your eye healthier.
Okay, get
So,
rid of the floaters too.
absolutely.
Mm. Yeah,
Absolutely.
I'm gonna have to see what I can do by getting getting these eye drops from you.
Okay. Do
Hmm
you have access to a computer where you can order them?
Not here. I don't. Not in my home, but my daughter does.
Okay.
Uh huh. Yeah. So I can get her to check it out for me.
Do Do you know enough about how TikTok works so you can get to messages if we send you a message on TikTok?
Uh, on TikTok. No, I ain't never had no messages on TikTok. I don't think I have. I got
Okay.
Messenger. Do it go on my Messenger?
Well, I don't have your phone number, so I can't send you a message on Messenger. But
I I'd be
when
glad. I'd be glad to give it to you.
I don't want you to just say your phone number on a live openly,
Oh,
because you never know whoever else might be grabbing it.
that's true.
Um,
That's true.
but I do have
I
your.
sent it.
I'm
I
sorry.
sent it. I sent it to his DM a while ago, but he didn't see it. So I think on October 3rd I sent it. But it's in there if he can figure out how to get his message.
Do you think your you think your daughter can help you find the messages on TikTok?
Let me see today. She'll be able to help me today after the. Well, she'll be able to help me tomorrow. She be
Okay.
out of town till tomorrow.
Okay. Okay. So that would be good. Um, because in the messages, excuse me, in the messages, Dana has sent you my phone number.
Okay. Okay.
Okay? So you'll be
Yes,
able to
ma'am.
get in touch with me. Now, I'm also going to send you some messages so that so that my information is at the top so you can easily find how to get a hold of me.
Yes, ma'am.
Okay?
Okay. I think this is a good platform. I came on here once. Uh, I said, let me listen. I really just listen tonight. Uh, you know, some things that happen to you, it'll make you really listen. And
No,
my eyesight is very important to me. I said, Lord, I don't want to go blind. I already got one I can't see out of. Then the next one, the other one start acting up.
yeah, and that's what happens because our eyes are not a two separate things.
Right.
They are connected to our brain and they operate together. So when one starts going, the other one's like, "Wait a minute, what's going on?" So we
Mm.
need to keep our eyesight as healthy as possible.
And do you think that I'd be able to get some of my eyesight back in my in my other eye, my left eye?
I have a customer who's having eyesight restoration who's 91.
Mm. Well, ain't that old?
Okay.
Yeah. Uh,
Well, I'm just saying
mm-hmm.
there's opportunity for everybody at some level. What degree we don't know, but the more you use the drops, the more consistent you are, the better the results are going to be.
Okay. Yes, ma'am.
Make sense?
It makes sense. Makes sense.
Excellent.
Okay. What's your name? Beatrice.
I'm sorry.
This name up here, I can't hardly see it. BARE.
Yes, it's Bearcat.
Bearcat. Okay,
Yeah,
Bearcat.
so the name of the
Oh,
company,
okay. Okay.
yeah,
Yeah, I remember that name now. Bearcat.
yeah, the name of the company is Bearcat Body.
Okay, Bearcat body. So I
Yes,
can know when I see a message come up, I know who it is.
100%.
Yes, ma'am. Uh, well, I appreciate you here.
No, I appreciate you, and
I
we'll
know
be in
you.
touch.
I know you're getting a whole lot of folks coming in. I heard say you got a lot of folk coming in. We can see about 165. I said, "Good Lord, have mercy." Uh,
Hey, I'm here to serve, so whoever shows up, that's my responsibility. That's my job to provide as much information as I can.
and it's good you gonna be on the 24 hours.
Yes,
Uh-huh.
exactly. So everybody's got a shot.
Right, right. Uh-huh. So I hope my daughter come on back tomorrow. I hope she I hope she don't go nowhere, but she's supposed to be going out uh about a couple 100 miles out tomorrow.
Okay.
Hmm.
Well, I'll be back in touch with you, and I will be on live. I'm doing this 24 hours, but I will probably be on again on Sunday.
Okay,
So,
okay.
okay.
That sounds good.
All right. Excellent.
Okay, thank y'all.
No, thank
Thanks
you.
for
Appreciate you.
coming up. All
Bye
right,
bye.
Patrick,
Bye.
go ahead and unmute yourself.
Have a blessed night.
You
You too.
too.
Patrick, you can unmute your mic. I sent
Hey,
you the
Patrick.
information on how to get the drops also.
Hey,
Hi, Patrick. How are you?
how you doing?
Excellent.
I'm
How are
good.
you?
How you all doing? Excellent.
We are fabulous. How can I help you?
Okay, I was just listening to you all about this your eye drops,
Yes.
and I wanted to know more about it.
Okay. What do you want to know?
I'm calling from Nigeria, actually.
Okay. Excellent. Excellent. Welcome in. Welcome in.
All right,
So
awesome.
what would you like to know?
Okay, I've had not too bad. I've had some issues with my eyes. I have the floaters. Sometimes it's difficult to read. Uh, and then going to the ophthalmologist, I really don't get satisfactory readings, and
Okay.
I can't. It's been quite a while it's been quite a while I've seen an ophthalmologist to really tell what the pressure of my eyes have been. So maybe I'll do that check and then possibly get back to you on that, since you need the readings for the pressure, right?
Well, what I like to know is how severe the pressure is. So I have drops that work at mild, moderate, and severe levels
Okay.
of glaucoma. However, I don't want to tell you to get the drop for the severe level when your level is mild. So knowing the numbers just helps me direct you to the right
Okay.
solution.
Okay. All
Does
right.
that make
I'll
sense?
run a check on that, and then how do I get back to you?
So
How do I get back to you when I get the test results?
I'm
I
live
sent you
on TikTok. You can actually get me on WhatsApp. Um,
Okay.
so because your account's private, isn't it? Whoops, he just went
no,
away.
I sent him the information already in his DM.
Oh, okay, okay. Well, when he comes back, we'll tell him
If he's still in there, uh, he's still in the room. I did send it to his DM.
that. All right, Patrick.
And anybody that comes up on the screen and has questions and stuff, I just go straight to their DM and drop the information in, so they'll have it for
All right,
reference,
excellent,
later references.
excellent, excellent, excellent.
Time for a tap party. We're at 10,900 likes, 51 people in the room. We're still
Woohoo!
at 118 shares. I think I'm. How many did I tap already? I think I'm over 1,000 taps. You're the only one that can see how many we've tapped.
How do I see that?
Oh, that's another place I looked. Maybe tap on us. I don't know. I can't remember. It's so much information. You just gotta know where to look for it at.
I know it.
Yeah, because when I was looking, I was like, "Oh, really? That's how I know." You might go up there in the top where it says there's 48 people, and then tap on. Then tap on those people. Let me see. No, that wasn't it. Let me see. Block. No, I don't know because you're gonna see something different than I see. So
Yeah, no, it doesn't tell me.
yeah, there's a
Oh,
someone. There's
'cause it just says like it diamonds. It says LV15, and hearts. It says LV16, but I know that's not like the number.
wait, you're looking at LV16. Mhm. Oh,
I
that's
don't.
what you're talking
I,
about. No, no, it's not in there. It's a list. It comes up as a list somewhere that shows you how many. Oh, something just popped up on my screen. My live, my story. No, that's not what I'm trying to do. Okay. I have to look around and play around.
yeah, my challenge is I don't know what I'm looking for, and I really don't want to.
I don't want to mess
I
nothing
don't.
up while
I
you're
don't want
live.
to. Yeah, I don't want to. I don't want to hit the wrong thing and like
Right.
mess something up because I
Yeah,
really
a lot
don't
of times
know.
a lot of times that's just how I found out. But just and then I had to remember how to go back and find it. That was and
No,
then
a
like you said.
hundred
They
percent
changed. They've been changing a lot of things around. I heard you and Coco talking about that last week. That something will be one place, and then you go back and look for it, and it's not there, and it's moved to another place. So yeah, and I think
exactly.
that's part of them keeping us engaged. You got to do. So I don't know.
Yeah, no, I think that is something about let's try and boost engagement, or you know you got to make people hunt around for stuff. But I'm like,
Well,
I only have so
anybody
much.
ever explain about the TikTok? Why it's called TikTok? That everything has to do with time. That's in the app. Everything is like I remember hearing somebody give an explanation about what the TikTok means, how they even came up with TikTok, and like you talk about the algorithm. I never could say that right, but
Algorithm.
all of that, all everything revolves around time and stuff. So,
Yeah, no, then and that's why they're being so hard, and now more than ever, because they're trying to create this sales scenario where TikTok's going to be sold to US companies, but
mhm,
they're really trying to hyper control, attention. They're trying to see all the different scenarios in the app where controlling attention is an opportunity to create revenue.
mhm,
So that's part of why all of these changes are occurring right now is because at some point there's going to be a sale, and that sale is going to result in companies that are going to be able to um, enjoy an awful lot of revenue from
mhm.
their ownership of TikTok. And they're looking at everywhere they can uh, garner attention so that they can figure out how to apply making money out of keeping attention.
Deep, deep,
Yeah.
deep, deep.
So yeah, 2 years ago, I read the part of the uh, Netflix annual report, and Netflix's biggest goal was how to fight against sleep. So the biggest issue of attention, where Netflix was concerned, was the human need to sleep.
So what? They don't want you to sleep. They want you to watch them.
Yeah, they want you to sleep less and watch more Netflix. Yeah.
Well, they got me on some parts because I get in things. I'm watching something and I just keep going to the next one and the next one and the next one and the next one. I'll get into a series or whatever, and then I'm like, make myself have to go to sleep. Like, Dana, it's 4 o'clock in the morning, you know. So maybe it's working, whatever it was, to get your attention because I will literally watch 10 episodes just to get because when it ends, that one was so good. I got to go to the next one, and I got to go to the next one. I got so I love Netflix. I just the
Yeah,
variety of
no,
stuff that's
I agree. I just think it's a poor model for business to create a scenario where you're potentially physically harming your customer.
mm,
Like sleep is a requirement. It's necessary for the human body. Why do you want people to sleep less
well,
just so you can make money? Like it's not I need you to sleep less because, there's some systemic issue that we need to deal with. It's just it's our profit line.
and they better watch it. You see what happened with the cigarettes when that happened, and you know it's not good for us. But there was a profit line, and a lot of things we didn't know about it. And then they start putting it on the packages. I mean, it's just a lot. Everything in our life that we do, something, not everything, can harm us, but they're still making money off of it.
No, 100%. 100%.
I mean,
But
exactly what we're
to
talking about today, the eye people, they're not there to cure it. They're just there to help you. There's no curing, and
yeah, no, they're
somebody's
not
trying to
even
help
looking
you.
for a cure.
Right. So, ooh.
Which is why, it makes you so jaded because the amount of money that we pour into um, these nonprofits, like to cure cancer, cure childhood cancer, cure breast cancer, they're not trying to cure anything. So, the whole premise is invalid. You're not looking for a cure. You're looking for medication that can allow you to live with this thing until there's no way that your body can withstand it anymore and you just pass away. But we want you to have 50 or 60 years living with it, paying us money to have this medication.
Got a question. Pauline, are you still awoke? I'm, I'm going to pass the reins over to Pauline because I know Coco's sleeping, and I'm going to come back in a few.
Okay, no worries.
Is Pauline awoke?
I think I'm gonna
I know
just
she said she was up. She said she was up because she's got to do something early.
she's going to work. Yeah, she's going to work in a little bit.
Hmm.
I just took Coco down because
That's it.
girl, go to
But
sleep
then she gonna be mad. Why you won't bring me back up? I can't bring myself up.
because you need to go to sleep. Wine
It
Ash
says earlier I
352.
wanted to speak on the medical industry, but I did not know if that was caution enough to do. Yeah, we just have to choose our words wisely as we talk about it, I think, so that she doesn't get any dings.
Yeah, no, yeah, you have to not you can't use any words that are threatening. Pauline says, I'm still up. There you
Okay.
go.
Go ahead if you want to unmute and you can talk to her. Keep her going. I'm gonna make myself go to sleep.
Go to sleep,
Just
Dana.
I'm gonna do pickleball in the morning at 7:30, so it's 4 o'clock already. But I'm gonna
Ex-
try. I'm not sleepy, but I'm gonna make myself try to go to sleep. Okay.
Go ahead. I'll see you later.
I applaud you for everything that you're doing. I
Thank you
would
so
do it too.
much.
I would do it too. All
Okay.
right.
Bye.
I love you.
Love you
Love you.
too. All right. Go get some sleep, ladies. Go get some sleep. Wine Ash 352. I'm very over. Okay. Very dissatisfied, disappointed with the medical industry in its entirety. So am I. So am I. 100,000%. Like, I'm going to try and bring you up. Okay. Okay. Yeah, you can accept and come back up if you want to come back up on the panel. Um, but no, the medical industry truly is just trying to profit off of our bodies. You know, would they? The goal is to keep you stable enough that you can go to work, so that you can get those benefits, so that you can have the insurance, so you can pay for the stuff that they are going to give you to keep you alive. That's all there is to it. So when we went through that whole opiate crisis, and it's probably still going on, people were legitimately in pain, and the answer was to get them addicted to a drug that would actually addict their mind in a way where they would need to have more of the drug consistently to have any kind of pain relief. And it just became this constant feedback loop. And, there are people that made billions of dollars. They made themselves uber, uber rich off the pain and suffering of others and consciously did it. It wasn't a mistake, it was a conscious choice. Okay. Elizabeth Terry, welcome in. I'm going to have ChatGPT inform us a little bit about Usher's syndrome.
Usher syndrome. Overview. Definition. Usher syndrome is a genetic disorder that affects both hearing and vision, and sometimes balance. It's the most common condition that combines hearing loss and progressive vision loss from retinitis pigmentosa (RP), a disease that damages the light-sensitive cells in the retina. Types of Usher syndrome. There are three main types classified by severity and age of onset. 1. Type 1, hearing, profound hearing loss or deafness at birth. Vision, early onset of retinitis pigmentosa, usually before age 10. Balance, severe balance vestibular problems, often delays walking in infancy. 2. Type 2, hearing, moderate to severe hearing loss at birth. Vision, retinitis pigmentosa begins in teenage years or early adulthood. Balance, normal balance function. 3. Type 3, hearing, normal at birth but progressively worsens in childhood or teens. Vision, Retinitis pigmentosa begins in late teens or adulthood. Balance may be affected in some individuals. Symptoms: hearing loss varies by type from birth or progressive. Vision changes: night blindness, first symptom, loss of peripheral vision, tunnel vision, difficulty adjusting between light and dark environments, eventual central vision loss in advanced stages. Balance issues: poor coordination, delayed walking, or vertigo. Usher syndrome is inherited in an autosomal recessive pattern, meaning a person must inherit 2 defective genes, one from each parent, to develop the condition. There are at least 9 different genes associated with Usher syndrome, including MIO7A, USH2A, and CLRN1, depending on the type. Diagnosis: genetic testing confirms the diagnosis. Hearing tests, audiometry, assess the degree of hearing loss. Eye exams detect signs of retinitis pigmentosa. Balance testing checks vestibular function. Treatment and management. Currently, there's no cure, but interventions can help maintain quality of life. Hearing aids or cochlear implants for hearing loss. Vision aids, magnifiers, contrast lenses, and mobility training. Vitamin A supplementation under medical supervision. May slow RP progression. Gene therapy and retinal implants are under active research. Supportive therapies, orientation and mobility training, speech therapy, and educational support. Holistic and supportive care. People with Usher syndrome benefit from a nutrient-rich diet, omega-3s, lutein, zeaxanthin, vitamin A, and zinc, eye protection from UV and blue light, low vision rehabilitation programs, emotional and social support networks, since dual sensory loss can be isolating. Would you like me to make a printable one-page educational sheet or social media post about Usher syndrome for Bearcat Body's audience?
There we go. Another autoimmune disease that is really debilitating. I'm just looking through the other options that I have here. All right, this is one that's interesting.
Crystals in the eye can mean a few different things, depending on whether you're asking about what doctors see under the microscope, what a patient experiences, or what's happening inside the eye tissues. Here's a breakdown. 1. Corneal crystals. These are tiny deposits that form in the cornea, the clear front surface of the eye. They may look like sparkling dots or glistening flecks. Causes: cystinosis, a rare genetic disorder where cystine builds up in the cornea. Lipid or cholesterol deposits, sometimes from systemic conditions or eye disease. Drug-related, some medications like indomethacin, tamoxifen, or certain antivirals can leave crystalline deposits. Effects may cause glare, halos, or blurred vision. Sometimes they are harmless and just discovered on an eye exam. Number 2, crystalline retinopathy. Crystals can also appear in the retina, the back of the eye. Causes: talc retinopathy from intravenous drug use. Tiny talc particles lodge in retinal vessels. Canthaxanthin retinopathy from very high doses of a tanning supplement. Oxalosis, oxalate crystal deposition in the retina. Inherited metabolic disorders like Beatty-crystalline dystrophy, a rare inherited retinal disease that causes shiny crystals and progressive vision loss. Effects: distorted or blurry vision, night blindness or reduced peripheral vision in degenerative forms. 3. crystals in the vitreous, sparkles or floaters. Sometimes patients describe seeing shiny or sparkling floaters, which may be due to asteroid hyalosis, calcium lipid deposits floating in the vitreous gel. Usually benign and often discovered incidentally. Appears like golden or white sparkles that move with eye movement. Usually doesn't affect vision much unless very dense. What can help? Eye exam is critical. A specialist can determine what kind of crystals are present and whether they're harmless or linked to a systemic condition. Treat the underlying cause. Manage metabolic or genetic disorders, e.g., cystinosis is treated with cysteamine drops. Adjust medications if drug-induced. Monitor for progression in inherited crystalline disorders. Supportive care, lubricating drops if crystals irritate the cornea. Low vision aids if vision is impaired. Nutritional support, antioxidants, omega-3s, lutein, zeaxanthin may help overall retinal health, though they won't dissolve crystals. Some people mistake sparkling floaters or flashes for eye crystals, but true crystalline deposits are a physical buildup seen on exam. Would you like me to make the comparison chart showing the different types of eye crystals, corneal, retinal vitreous, their causes, symptoms, and treatments, so it's easy to explain to your customers and audience?
That was valuable. I don't know that there's so many things. And here we go. We're gonna also do this one. I want to make sure nobody's asking any questions.
You're asking about non-arteritic ischemic. Most likely you mean non-arteritic ischemic optic neuropathy, NIN. Here's a clear breakdown. What it is. Non-arteritic ischemic optic neuropathy is a sudden loss of vision caused by reduced blood flow ischemia to the optic nerve head. Non-arteritic means it's not caused by inflammation of the arteries, like in giant cell arteritis. It is the most common acute optic nerve disease in older adults. Who is at risk? NION usually happens in people over 50, and risks include hypertension, high blood pressure, diabetes, sleep apnea, high cholesterol, smoking, having a crowded optic disc, small optic nerve head with little space for blood supply. Symptoms: sudden painless vision loss in one eye, often noticed upon waking. Loss can be partial, upper or lower half of vision missing, or more severe. Colors may appear less vivid, usually does not cause eye pain, unlike optic neuritis. Prognosis: vision loss is often permanent, but some may have partial recovery. The other eye has about a 15 to 20% chance of developing NION in the future. Conventional management: there's currently no proven treatment that restores vision in NION. Doctors focus on controlling risk factors, managing blood pressure, diabetes, cholesterol, treating sleep apnea, avoiding nighttime low blood pressure from medications. Natural and supportive approaches, general wellness. While natural remedies can't reverse optic nerve damage, supporting blood flow and nerve health may help protect the other eye. Omega-3s, fish oil, flax, algae, support microcirculation. Antioxidants, lutein, zeaxanthin, vitamin C, vitamin E, protect nerve cells. CoQ10 supports mitochondrial energy, health in optic nerve cells. Lifestyle, quitting smoking, good sleep hygiene, exercise for circulation. Summary: non-arteritic ischemic optic neuropathy is a sudden, painless loss of vision from poor blood flow to the optic nerve, usually linked to vascular risk factors. There's no cure, but controlling risks and supporting overall eye and vascular health are key. Do you want me to also show you how NION differs from arteritic ischemic optic neuropathy, AL? So it's crystal clear when explaining it to your audience or customers.
Okay. These are big issues in the eye system. Oh, here's one more. This is a big one.
Uveitis is inflammation inside the eye, specifically affecting the uvea, the middle layer of the eye that includes the iris, colored part of the eye, ciliary body, helps the eye focus, and choroid, blood vessel layer that nourishes the retina. Types of uveitis. Anterior uveitis involves the front of the eye, iris. Most common type. Intermediate uveitis affects the gel-like vitreous in the center of the eye. Posterior uveitis, inflammation at the back of the eye, including the retina and choroid. Panuveitis, when all parts of the uvea are inflamed. Causes uveitis can be linked to autoimmune diseases like rheumatoid arthritis, lupus, sarcoidosis, ankylosing spondylitis. Infections, herpes, syphilis, tuberculosis, toxoplasmosis. Eye injury or surgery. Unknown causes, about half of cases. Symptoms: eye redness, eye pain, blurry vision, light sensitivity, new floaters or dark spots in vision, reduced vision, complications if untreated, glaucoma, cataracts, retinal swelling, macular edema, permanent vision loss. Treatment: corticosteroid eye drops, first line for anterior uveitis, oral or injected steroids for deeper inflammation, immunosuppressive drugs if caused by autoimmune disease, antibiotics or antivirals if caused by infection, dilating drops to relax the eye and prevent scarring. Would you like me to also put together natural and supportive remedies for people managing uveitis?
Uveitis is a big deal. It's a big deal. All right, Fritz Alk. I'm not sure exactly how to pronounce the last name, but Fritz says, hello there. Quick question. When you heal your eyes, did you change your diet as well? I did not. So I did not. That's me. I know there are many of my customers that have, and they've had, even more stellar results than I've had. So, but I didn't change my diet. So, and I eat a lot of vegetables, and I eat lean meat, and I also eat a lot of crap. So, I kind of balance in between the really, really good stuff and the really, really crappy stuff. And I don't know how that affected my eyesight overall or how it affected me actually winding up with cataracts, but I don't think it impeded the recovery from cataracts. All right, I'm going to hit some music and I'm going to take another break. I'll be back in just a few minutes. Please hang out.
Okay.
Well, now I don't know how I got the music. Oh, there we go.
A lot of people are still coming in.
Yeah, no, we're keeping a run. Like people are still coming in.
Yeah. Lovely baby. Thanks for the hearts.
flowers.
Welcome in, everyone. Welcome in. We'll be on screen in a few minutes. Welcome in. Welcome in. Welcome in. Welcome in. Welcome in. We're still here. Welcome in. Miss Unapologetic. Welcome in. Thanks for liking the live. Welcome in. Welcome in, everyone. Welcome in. Welcome in. Thanks for joining. Welcome in. Thanks for sharing the live. Welcome in. You could just put your finger over the top of the eyeball and hold it down, and on your screen you see your friends. You could just send the live to them. You could share with them. Thanks for liking the live. Welcome in, guys. Leslie will be right with us. Just took a minute. She'll be right back. Yes, and anyone who have questions when she come back, just put it personal. She'll be right with us. Just took a quick minute, because every one of us need to. Yeah, welcome in, everyone. For anyone who's just coming in, Leslie will be right back. She just took a quick break that all of us need. So welcome in, make yourselves at home. Thanks for liking the live. Welcome in, everyone.
I'm back.
Yay!
There we go. I am back. Thank you so much for the break. I appreciate it. What's Dana doing back?
She just came back on to tell them to tap.
Stop it.
But I welcome quite a few people in and told them you took a quick break
Thank you.
that we all need. And then they said, okay, I'll stick around.
Excellent, because I am here. I am back. And I am here to talk about eyesight and eye health and how you can naturally restore your eyesight and your eye health using these wonderful products that I have for you. I also have a BOGO sale going on this weekend through Sunday night on the Revitalize eye drop. This is a moisturizing, hydrating eye drop. And if you've got any level of dry eye, this can be a game changer for you. It is absolutely fabulous. Um, and then also my go-to eye drop is the 3070. This is 30% DMSO. DMSO stands for dimethyl sulfoxide and 70% Jamaican black castor oil. And all of these are meant to be eye drops dropped directly in the eye. Dana's like, I'm tapping in my sleep. Please, girl, go to sleep. This is the Revitalize that because we have the white label, and that's the label that we use now is completely the white label always. Revitalized. But we're rolling into, deep into fall and then directly into winter. And I think winter might come, excuse me, forgive me for yawning, a little faster than we think. I think it might get colder faster this year. And that means that we're going to be living with heat everywhere. So in the house, in the office, in the car. And that's very drying to the body. It's drying to the eye system. And this is the opportune time to get yourself some moisturizing, hydrating eye drops. And mine are called Revital Eyes. Revital Eyes. And they are a game changer. And a 1 ounce bottle, which lasts between 90 and 120 days, is just $18. So you're going to get two for one through Sunday. So that's part of the reason I'm here on live. The other part of the reason that I'm here on live, I'm doing this 24-hour run, is because I want to introduce myself and my business to more people. And my goal is to just connect with as many people as I can over the next 24 hours. And then I'm on live on TikTok Monday through Friday from 7 p.m. to 8 p.m. And that's just my regular time slot. Uh, and I'm also going to be going on to YouTube and doing YouTube live from 8:30 till 11 o'clock. Monday, Wednesday, Friday. I think it's Monday, Wednesday, Friday is when I'm going to be doing YouTube live. So, and I have a tool that supposedly allows me to stream across multiple platforms. Excuse me again. I haven't figured out how to use it yet. But when I have that tool up, I'm going to be streaming across TikTok, YouTube, and Instagram on a regular basis. And I'll probably get dinged because I said the names of those other competing companies, which TikTok is now saying is a no-no. It is what it is. Okay. So TikTok is saying, great job. You've gone live for 90 minutes. Don't forget to take a break. Thank you. I just came back from a break. Good for me. Hey, Junior Maldonado, how are you doing? He says, hey, great day. Blessings always to all. Yes, blessings to you too, without a doubt, Junior. So glad to hear from you this morning. Glad you're in. I'm on my 24-hour live, and I don't know why TikTok said 90 minutes because I've been on since midnight. And you know, I'm here. But that's way more than 90 minutes. So I guess it's just an additional 90 minutes. And there we have it. Okay, so Blind Betty 1126 has joined. Blind Betty, I hope you're not blind. I truly do. I truly do. Great, Junior. I hope you're feeling great. Did you go for a walk yesterday? Did you get your walk in? Yes, indeed. Absolutely fantastic. Love that. Hang on. Washington took mom to eye doctor today. Suggested to see a neurologist. What what must he have seen? So, wow. She's got something neurological going on. Does she have um is she talking about like seeing static? Because it could be visual snow, which is a neurological issue that actually shows up in the eyesight. Any chance that that's what the doctor is could be looking at or referring to? Come on up. You've been there. You go.
Hello.
Hi. How are you?
Well, I was getting ready for bed and then I saw this and I thought, oh, I better go ahead and stay up a little bit longer. You were out on break and here I am. I got a question before I go to bed.
Okay. No problem.
So I took mom to the eye doctor and he didn't really give me much information. He just said, get in contact with your primary doctor and you need to get a referral ASAP to your neurologist. So I'm not understanding exactly what he must have seen. That's why I was asking. Um, I don't know. She had cataract surgery about 2 years ago,
Okay.
and she everything was good. We went to the follow ups and everything, and this was her annual, and he said everything with her vision was good. That was the only concern, but now I'm concerned.
So, and this is your optometrist.
Correct.
I'm actually asking ChatGPT, why would an optometrist want a patient to see a neurologist? So she didn't have any sudden vision loss, correct?
No, the only thing is she she says that she can't see the same, as in maybe her peripheral vision is not the same it used to be after the surgery, but she still, I mean, everything else looked fine.
Okay, so here's what ChatGPT says. It says, so these are the reasons that an optometrist would want a patient to see a neurologist. Sudden vision loss in one eye or both, visual field cuts, so missing areas in vision, double vision, eye movement abnormalities, pupils reacting abnormally to light. Um, and these can point to nerve or brain involvement, such as optic neuritis, so inflammation of the optic nerve, multiple sclerosis, stroke or mini stroke, brain tumor or aneurysm, and migraine with an aura. So she didn't report a migraine or anything like that, right?
No.
Did he dilate her eyes?
Yes, he did the regular eye exams, and then he said, I'm going to go ahead and ask. Well, he asked me to go ahead and step out. He said, I'm going to do an extra exam on her. So I know he did. He went out of his way to do something else. I don't exactly know what it was. The only other thing was that he said something about, has there been, is she, whenever we said that she was had not lost, but she just notices that she doesn't have the same peripheral vision. He said, is it out of one eye or both? And I said, well, she only complains about her right eye. And then he's like, mm-hmm, that's it.
Okay. So the other thing that he could have seen is a mini stroke in the eye. I'm really surprised that he didn't tell you what he was seeing. And I would actually call back the office. I'd call the office back and say, I need a detailed report of
He
what you're
did.
seeing. And what did they say?
Because he had told me to get in touch with her primary, so I called the primary to see if we could get a referral to a neurologist. And the primary said, well, we need something faxed in, or we need something to
Right.
let us know
Some
what he
some
saw.
reason why you're doing that.
Right. And then he said that he wasn't going to fax or anything, that he wanted to talk directly to the doctor. So he called the primary and they spoke, and that's all I know.
Okay. I would suggest you get another doctor, and I would suggest you get a second opinion,
Okay.
because it sounds to me like this optometrist, although he may have seen something that is triggering all of this, it doesn't sound like he's sure of himself, or he would have told you or written it down so that he could then send it on to
I
the
just find it
primary
kind of
care.
odd.
Huh?
Mm-hmm. I just find it kind of odd.
No, it's very odd. It's very odd. It's like you're trying to put somebody um, in a situation where they have the ability to go see a doctor who's going to help a situation, but you don't want to tell anybody what it is. So that
Okay.
means either you're not sure what it is and you can't diagnose it, or you're setting it up to be something different. You're trying to pad your wallet or protect um, your practice.
Hmm. Okay.
So
Well,
I would go see another optometrist ASAP, and I would not say
okay.
anything about what the first optometrist has said.
Okay.
Just let them do the exam and let them tell you what it is they see.
Okay. Sounds good.
I would do
Yeah.
that. Yeah, I would do that, as quickly as possible, and make sure whoever it is, a reputable optometrist. And then if they tell you, you need to go see a neurologist, you need to know why. And if are you signed on? Did you sign like all the HIPAA stuff so they can talk directly to you about your mom's case?
Yes.
Okay, then that's all you need, because there's no reason that they can't tell you the whole of what's in, you know, what they found.
Okay.
So,
Alrighty. Well, I will definitely do that tomorrow.
no, 100%, 100%. And yeah, that's kind of crazy. And did your primary care say, like, go back and tell you what the optometrist said?
I wasn't there. I was supposed to email them or fax them something. So I gave them their number and they spoke, but I don't know what they said. I went ahead and I scheduled an appointment with the primary because the primary wanted to see mom as soon as possible. So I called before the day was over, and they said, okay, well, we'll just get back to you tomorrow.
Really?
So the urgency
Okay.
kind of just delayed.
Had your mom has your mom showed any signs of a stroke?
She had a small one back with COVID.
Okay, I mean recently.
No, no, not recently.
So do you know what to look for in a stroke?
Somewhat.
Okay. So I want you to look for signs that she may be hiding. So strength, a loss of strength on one side of the body,
Mm-hmm.
the inability to say certain words, and S's and N's and Z's are,
Okay.
you know, so, you know, ask her to say certain words, and you can actually find a list of words to ask stroke victims to say that are difficult for them to say. You want to make sure she's got the same level of strength on both sides of the body and balance. So
Yeah, she walks and I mean, she's fine. Everything seems normal. That's why it's odd.
okay, so do it one side at a time. So ask her to stand still, lift one foot, put it down, lift the other foot.
Okay.
Okay. She may not
Okay.
even know that she may have had a mini stroke. She may not even know it, be aware of it, because we automatically start to compensate when we're not, you know, comfortable or confident. We just automatically compensate for it.
Mm-hmm.
Do you mind
Okay.
if I ask how old your mom is?
She's 75.
Okay. So I would look for those things right away. I would also um, put her on an aspirin therapy, an aspirin a day.
Mm-hmm.
Okay.
Okay. Okay.
Until you can see, you know, your primary care and then go see whoever else you're going to see next.
Well, I guess I better do this early in the morning to figure out what's going on because, yeah, I'm kind of,
I would. You should be a little freaked out.
yeah, I am. So I
Okay.
was getting ready to go to bed and I saw the eye on the screen and I thought, okay, maybe this is a sign I need to ask somebody else.
Yeah, no, you need to get her situated, and if she had an eye stroke that's, you know, a small stroke in the eye, she could have a larger stroke in the eye. Like the doctor not telling you what's going on with her case is unacceptable.
Mm-hmm.
And I would never go back to that office again.
Okay. Well, thank you so much. I was already getting ready to go to bed, but I just thought I'd ask. So
No,
I
totally
appreciate your
understand.
time.
No, no, I appreciate you and all the best for you and your mom.
Thank you. God bless you.
Okay, God bless you too.
Okay, bye bye.
Bye. All right. Christ redeemed J Can 45. My right eye endured a retinal detachment. Will these drops help me? It's been since August of 2015. So, did you have any surgery to actually reattach the retina? Come on up on the panel and let's have a chat. Uh, Cuckoo Pie. Hi, I'm turning 50 and I'm struggling with my eyesight. I would recommend that you get the 3070 blend, and the Revitalize, 100%.
Hello.
Dana? Oops.
Hello. This is J.
Hello. Oh, okay. Hi, how
Christ
are you
Dean.
doing? Hi.
I'm wonderful. How are you?
I'm great. I'm great. How can I help you?
I have been enduring this retina detachment since August of 2015. Um, it was a lot going on around that time, so I'm not quite sure what exactly happened, but I also have been dealing with diabetes most of my life. I
Okay.
have diabetes 2 at the present. I'm working on it. I'm
Okay.
exercising. I've changed my diet. I've done a lot. However, I did not know if I could receive any benefits from these drops if I were to take them now.
Did you have surgery to repair the retina?
Yes, I tried. They tried to repair it. Went back for a follow up, and I started to see out of it, but then um, he did some kind of adjustment or something. I'm not sure. It's been quite a while, and I haven't seen out it since. Out of it since.
Okay. So, is there an opportunity? Yes. How much of an opportunity depends on how healthy the eye actually is,
Okay.
and whether you still have blood flow, and all of the inner workings of the eye are actually still intact. And the fact that you can't see it out of it, can you see shadows at all?
No, it's just when I close my good eye with my left eye and try to look out of the right eye, I see
Yeah.
nothing. I just see dark, you know. I can tell that
Can you?
I can truly tell that I can tell that there's light, and it just may be that I've gotten familiar with how the light feels on my skin, but I can tell that there's light in the room.
Okay. And you haven't had it examined by another ophthalmologist since the adjustment that the doctor made?
Oh no, I had a couple of ophthalmologists, optometrists to check my eye. I actually go to the optometrist every year. I go annually as well as the ophthalmologist so that they can see if anything has progressed past where it is, and it's stable. It's not getting worse, which I don't know what that worse would be. And it's not getting any better either. It's just stable.
So, and there's no glaucoma in the eye.
Not that I know of. They never told me there was glaucoma there. Now, my optometrist did say that there was a cataract there. He, along with the ophthalmologist, they both said they don't see a reason to remove it if it's not causing me any pain or anything like that,
Right.
because I can't see anything out of it. So they, just pretty much leaving everything alone.
So is your eye operational? Like when you look left or right, does your eye automatically move?
If you saw me right now, you wouldn't think that I couldn't see out that eye.
Okay. So then I think there's a very high degree that you can get some sight back in that eye.
Okay.
A very high degree. I would actually put you on the foreign eye and the 40/60 and the C Clear eye drops. I would put you on those immediately, and I would put you on them. You're not taking any other medication.
The only medication I am taking is to assist me with the blood, the
The,
diabetes.
okay, so no eye drops though.
No, ma'am.
So I would want you to on them 5 times a day for 3 weeks, then 4 times a day for 3 weeks, and then you no 4 times a day for probably 6 weeks, 3 times a day for another 6 weeks, and then go down to twice a day.
Okay, so you
So
would have to be very clear with me because where would I get the? I just joined, so I didn't get the information prior to. So you would have to educate me on where I would get the drops and etc.
yeah, no, I'm going to DM you. So that's going to be
Okay.
the easiest way to get you the information. I'm going to
Okay.
DM you, and then you're going to go from there. And really, what I would like to do is DM you my phone number and
Okay.
have you call me outside of this live so that we could have a little more extensive chat and
Okay.
then I can, point you where you need to go to actually get the drops and give you the protocol of use.
Understood.
So
Yes,
you're
ma'am.
going to do this for this many weeks, so on and so on and so on. And because you currently don't have sight in the eye, I would want to talk to you probably every 2 weeks to see what
Okay.
kind of changes are happening with your eye.
Okay. Sounds good.
And I would want you to treat both eyes.
Okay.
Okay?
Yes, ma'am.
All right, excellent, wonderful. Let
And
me
thank you.
no, you're totally welcome. Totally welcome. Let me do this. Okay. I'm gonna try and see if you can get this message. Let me know if you can see that message.
I probably would have to exit your live to see if I can go see it. I'll message
Okay.
you. I'll comment here in a minute.
Okay. All right. There we go. Okay. Done, done, done. Excellent. Junior, thank you for sharing the live. I really appreciate you. Okay. Cindy Holt 77. My pupils do not dilate. Your pupils do not dilate. Can you come up on the panel? Zindaji, thank you for joining. Welcome in, welcome in. Okay, Cindy Holt 77, I sent you an invitation to join the live. I'd really like to talk to you because you're saying your pupils do not dilate. And it actually says your pupils so not dilate. I'm imagining it's do not dilate, but it's pupils, so it's plural, and I'm thinking that you're saying that that's true on both eyes. And I need to understand what's actually happening with your eyes and whether this is something that started with some kind of trauma. Hang on, Christ the Redeemer. Okay, Christ Redeemer, see if you got that message. James Warren Jr. 88.
Yes.
Hi, you're up and I can hear you. How can I help you?
Yes, I have watery eyes and floaters, and it feels gritty.
Okay, you've got dry eye. You got dry eye, and you're in luck because I'm having a BOGO sale on Revitalize. This little jewel right here.
Hmm.
This is a game changer for anyone with dry eye. But that's what you've got going on. Even though your eyes are watering, the reality is your eyes don't have a good quality tear film. So there's constant water running trying to hydrate your eyes. And that's also why you have that that gritty feeling in the eye, feeling like there's a foreign body in the eye.
Right.
Um, so here's the deal. For the floaters, you need the 30/70 blend. And when you buy the 30/70, you get the Revitalize for free. So I would recommend that you get the 30/70 blend and start using that 3 times a day. So you're
Oh,
going to use the Revitalize for the first, and because you've got serious dry eye, for the first 7 days, you're just going to use this drop, Revitalize. And you're going to use it 6 times a day. So 6 drops a day, however you can get it in your eye, you're going to get that in your eye. And then you're going to start using the 30/70 3 times a day once you've done 7 days with this.
okay.
Okay?
Okay. Thank you.
You're more than welcome.
Alrighty.
Do you need anything else?
No, that would be it. Thank you so much.
All right. You're more than welcome. You have a great day.
You too.
Okay. Bye bye.
Bye-bye.
So, yes, Christ redeemed. I am sending the message direct to you. Oh, I got to play this stupid game. Got it. I hate these puzzles. Okay. Dana, were you able to send the message to Christ Redeemed? I wanted to send my phone number so we can connect, and thank you.
Oh, I'm still here, even though I'm not saying anything.
Okay, excellent. Cindy Holt 77. For some reason I can't connect on live. Ah, that's annoying. All right, then. Okay, Christ Redeemed. I am Leslie. So just so you know, you said you received a message from a Leslie. That's me, a Leslie. Okay, so Cindy Holt 77. It's a shame you cannot join. I'm trying to figure out the best way to ask the questions I want to ask. So, first of all, are you talking about both of your eyes don't dilate? Sassy Cassie 321, thank you for being the number 15 fan in the fan club. Appreciate you. While I'm waiting for answers from Cindy, you guys, let's have a little tap party. Just tap on the screen. Let's get some likes rolling through. Let's do it. Let's do it. Let's do it. Woo! More confetti. I must have hit 100 likes or something like that. Cindy Holt, let me know you're still in the room. All right. Excellent, excellent, excellent. Pauline, what time do you go to work?
I leave at 8.
Okay, dude, I got you for some time. That's a bonus. We currently have 46 people in the room and 12,000, looks like 700 likes. So if you like what you're hearing and you like how I'm spending this time, feel free, please do tap on the screen. Let's get it going. I got to get the algorithm to fall in love with me again. Hey, 1738, thank you for liking the live. CC, welcome in. Brooklyn Diva, welcome in. Okay, I'm going to throw up a subject. Let ChatGPT inform us of some stuff. So this is something I found out about today or yesterday, and I find it interesting. because it is about how there are companies that
Got it.
are,
You're talking about placenta-derived therapies, mainly amniotic membrane.
yeah, placenta-derived therapies for the eyes. So it's just like it was a whole interesting concept to me. Hey, Seventh Wonder. Dana's letting you know, yes, I'm on for 24 hours. I've been on since midnight. So 11:58 is when I clocked in. Hi, Queen. What are you doing on so early? Brooklyn Diva, you are more than welcome. Yeah, no, it's a wow, without a doubt.
Got it. You're talking about placenta-derived therapies, mainly amniotic membrane,
I'll be
which is
excited when the
part of the
sun comes
placenta,
up so I can
used
stop
on the eye,
yawning.
like Procera. Here's a clean list you can use. Have placenta-derived eye treatments, human amniotic placental tissue. A. Self-retaining amniotic membrane devices, bandage rings. Procera, biotissue. Cryopreserved amniotic membrane clipped into a ring that sits on the eye for several days. FDA cleared as a therapeutic device for ocular surface disease, e.g., persistent epithelial defects, neurotrophic keratitis, severe dry eye flares, burns. FDA access data. Sutureless in-office amniotic membrane discs, no ring. Ambiodisc, Corza ophthalmology. Dehydrated amniotic membrane disc placed on the cornea, often under a bandage contact lens. Used for recurrent erosions, neurotrophic ulcers, chemical thermal burns, non-healing epithelial defects, and severe dry eye associated disease. Corzai.com. C. Surgical amniotic membrane grafts, amniograft, biotissue. Cryopreserved AM used as a graft in the OR clinic to reduce inflammation, scarring, and promote epithelial healing, e.g., pterygium surgery, conjunctival reconstruction, persistent epithelial defects. Biotissue, Ambio 2, Ambio 5. Corza ophthalmology. Dehydrated AM sheets for surgical applications, pterygium, chalasis, ulcers, erosions, burns. Corza Medical Global D. Amniotic membrane extract eye drops, research biologic preparations. Amid, AMED, amniotic membrane extract eye drops, drops derived from amniotic tissue. Early clinical studies and reviews report improvements in severe dry eye, epithelial defects, and other corneal wound healing disorders. Preparations vary, fresh, homogenized, lyophilized. Availability and regulatory status differ by country clinic. PubMed E. Related placenta-derived biologics sometimes used on the ocular surface. Umbilical cord serum, UCS, drops. Not amnion, but still placenta-derived. Studied for severe dry eye, GVHD, neurotrophic keratitis, etc. Often similar use cases as autologous serum. What conditions these are used for? Examples. Persistent epithelial defects, neurotrophic keratitis, severe intractable dry eye disease, chemical thermal burns, recurrent corneal erosions, post-infectious keratitis, pterygium surgery, conjunctival scarring disorders. AAO, wide placenta amniotic membrane. Amniotic membrane is the innermost layer of the placenta. It's anti-inflammatory, anti-fibrotic, and supports epithelial regeneration. Basically, a biological bandage for the cornea conjunctiva. If you want, I can turn this into a printable comparison sheet. What it is, typical wear time, common indications, billing FDA notes.
So there we have it. People that have extremely severe dry eye, they're using basically, biological material from childbirth to actually bring about some change in the eye system. Seventh Wonder says my eyes are stable, no worse. And that's excellent. So stable is always good, especially when we're talking about glaucoma. However, what you want is improvement. And I would add another 2 doses of the eye drops that you're using a day, 2 a day, to let's see if we can bring stable into my eyes getting better and better and better every day. I'm ready for some coffee and for the sun to come up. I just need a change in the light in my space. Be beneficial. Nash 352, thank you for liking the live. Appreciate you. We got 48 people in the room, and there's no likes going, and there's no questions going. How is it? Is everybody asleep? Is it just me? Brooklyn Diva says difference between Revitalize and See Clear. Both are for eye lubrication. Yeah, well, for moisturization and hydration, without a doubt. But I'm going to give you the list of the ingredients in the See Clear. The Revitalize is hyaluronic acid, um, vegetable glycerin, and a Celtic salt saline solution. And here's what's in the See Clear. So the quintone saline solution, so this is a high-end saline solution, castor oil, chamomile tea, hyaluronic acid, polysorbate 80, liquid lutein, zeaxanthin, aloe vera, and Euxol PE 9010 preservative. So the See Clear is just a whole different eye drop for the purposes of adding vitamins and minerals back into the eye system. The Revitalize is to hydrate and moisturize the eyes and get the eye material ready to be able to absorb the other eye drops. And that's why it's a companion to all the other eye drops. So when you drop it, you know, everything absorbs and you're good to go. It's 5:11, 5:11. I'm going to have to open up my curtains here shortly so that I can see the sun rise. I can't actually, I'm pointing west, so I can't actually see the sunrise. The buildings are too high, the trees are too high, and pointing in the wrong direction. However, I do like seeing the light come into the sky in the morning. Brooklyn Diva, got it. Thank you. You're welcome. You are welcome, without a doubt. And I need light because my eyes are heavy right now. Like I've been up now. I've been up 24 hours. So because I woke up yesterday at 5 a.m. So I've been up 24 hours already, and I have so many more hours to go. I'm probably gonna wind up taking cat naps. Like I take a 10-minute nap and put some music on and let you guys listen to some music, and then I'll close my eyes for 10 minutes and then I'll be back and bust back into it. Yes, Junior, coffee. Yes, 100%. I need something to wake me up, motivate me, without a doubt. Questions would do the same thing. Like if I had questions about eyesight and eye health and eye care and, aging eye related diseases, I'd be good. I think I'd be good. Renee, baby, welcome in. Oh, somebody wants to come up on the panel. Junior, come on up.
Hey, Blessing, what's up?
How are you doing?
I'm doing good. I have a joke for you, just in case.
Okay.
I have this follower. We follow each other, and he put something like, "If you win $78 million and your mother needs an operation that is going to cost you 77 million, what would you do?" And I put you down. Like, I have this lady that will actually help you. That would cost me much more cheaper than the 70
Oh
million.
my God.
You know what happened, right?
Yeah, you failed.
No, TikTok banned me.
Are you serious?
I'm serious. They try to ban me. I appealed real quick. The only thing is that they banned you, but then you could appeal, and then when they look at it, I'm like, you can't respond to them. It's like whatever they want to do, they're gonna do.
No, 100%.
So I put your screenshot. I'm like, why don't they let me respond to them? And I was like, it's a shame. It just happened.
Oh my gosh.
I'm like, she's on TikTok. All she talks about is that. Why are they banning me? It's a joke. I'm responding, you know,
Exactly.
I'm
That's
responding the way it should be.
that's because AI doesn't joke.
No, they got to put some humor in it. It's crazy.
No, it is crazy. It is crazy. And so the way that they've modified the algorithms now, it's just really stressful to try and communicate on TikTok because there's so many words that they are sensitive to.
Exactly. It's like ridiculous. And I didn't say nothing negative. I was like, I sent you a screenshot. I was like, this lady would actually help her. It's going to cost me less. That's it.
Right. It was, I was kidding.
When I would try to go back, they released me. They released me from being punished. But I went back to the page and my comment is not there no more. And I'm like, okay,
Yeah.
it's a shame. It's
Yeah.
funny. It's funny.
That's what's happening. That's the TikTok land that we live in right now
Right.
is.
I send out like you saw. I shared your live,
Thank you
and
so much.
people are watching you from the shadow. I was like, don't go into the shadow. Go in. Talk to her. Add something.
Well, people are going to do what they're going to do, and there's nothing I can say or do that's going to change their desire to either, come in and have a conversation or just stand on the sideline. Either way,
They scared of
hopefully.
the broken English. I was like, if you have broken English, mine's just shattered. So
Oh my
why you worry
gosh.
about it?
I'm not an English teacher. I'm not here trying to grade anybody's
I
skills.
told them I'm there with her. I come and go. I'm sending out shares. I'm checking out who's awake. And
Right.
and if anything happens and she don't understand, I'll text it to her. Don't worry about it. Just keep going. Go in, join, ask.
100%.
One lady texted
Well,
me, what is she saying? She's talking about eyesight. She's talking about problems. People asking her about things from the problem eyes. I mean, she's not a professional, but she'll guide you through something. She might recommend you something. Just ask.
no, 100%.
Everybody keep asking if you're the doctor. No, she's not, but she knows enough about the eyes.
I'm not a doctor.
Everybody thinks that doctors are professional. Doctors are not professional. Not all of them.
Well,
They're not here to help.
they've been trained to do one thing. I'm doing something very different.
Exactly. Exactly.
But we've got some other people up on the panel, okay?
Okay, let me go. Blessing.
Blessings. Focus 14.
Hello,
Hi, how are you doing?
I'm fine. How are you doing?
I'm excellent. How can I help you?
Okay, I'm in London. I'm calling regarding like some of your products that you
Okay.
do.
Yeah.
My issue is I wear glasses. I was studying for a long time and I was wearing my glasses and it was okay. I would only need them to like use it for the computers. However, I tried like contact lenses like for 2 days in a row, and after wearing them, my vision just went like downhill. Now I can't even see without my glasses. I can't even see people's faces. I keep on going to the doctors and I keep on going to the eye specialist and they're telling me, oh, there's nothing wrong with my eyes. But then for me, it's just going straight downhill where now I can't even see if I'm even in my house. I can't even see myself. I can't even see like it's just and I'm so worried. And it's like they're telling me still that there's nothing wrong. They can't see anything wrong. But for me, it's quite different.
Right.
So I don't know if any of your products that you've got I could try.
Yes. So uh, there's actually two products. You're going to get the Revitalize for free because that just comes free with any other eye drop. This product here,
Okay.
but what you need to try is the 3070 blend, and the C Clear. The C Clear without DMSO. So there's a C Clear with DMSO. You don't want that one. You want the C Clear and the 3070. Those two eye drops.
Oh, I'm just gonna write that down because the thing is, I'll be coming. Where in America are you? Because I'll be coming to Miami the end of the month.
Okay,
So
I'm actually in Atlanta.
okay,
So I'm in Atlanta, Georgia. But I mean, if you're in Miami and you're coming to Miami, you've got an address, I can absolutely just send it to that address. Not an issue. And it'll be there in one day.
in one day.
Yes,
Okay,
because I'm that
okay,
close.
okay. Because they told me that my eyes are really dry. I've been dropping these eye drops that I'm buying, and they're still not helping. Nothing is helping. It's just going worse and worse and worse. They're even telling me, oh, I should try the contacts again. And I was like, it really, I can't do that because it's like you guys are not listening, you
This
know?
will help. And the contacts will actually feel better when you get your eyes hydrated and moisturized. So the dry eye is a huge um, participant in what's going on with your eyesight.
Okay. Okay. So if I get your number or how do I contact you when I get there?
So are you gonna place an order, in the UK and then come here, or are you gonna place an order when you get in the States?
It would be easier for me to place it there and then I collect it whilst I'm there because I'll be
Okay.
there for like 10 days.
Okay. No, that's totally doable. So
So,
here's what I'm gonna do. I'm
mhm,
going to Here we go. I'm gonna give you my name
okay,
and my phone number.
okay. So I'll go to my. I don't even know how this thing operates.
You should see in the chat. You should see my name, Leslie Wright, and then my number after that.
Okay, where in the chat? Hold on. Okay, I see a 30/70 and the revitalize and secret
Okay. Yep. And that came from Dana.
that came from Dana. Yeah.
Uh huh. And if you look below that, do you see? where it says Bearcat Body, and then it says Leslie Wright.
No, I can't. No. I see the one from Dana.
All right, it's blocking. TikTok is blocking the message.
Yeah, I can't
Dana,
see.
if you don't mind, could you send her my phone number? I don't just send her my phone number. It's the easiest way to do it.
I'll just do like anything to get my eyesight back. This is so frustrating.
Yeah, and I know it is because what the doctors are telling you is in the operation of your eye, everything looks fine.
Yeah,
But the reality is when you're looking out of your eyes, everything is not fine.
not fine at all.
Right.
And it's like nobody's like understanding. Nobody's getting it. They're just telling me, "Oh, buy that, buy this." I'm trying everything that they're telling me to try, and it's just not working. I don't know if literally like they're not understanding. My vision is like going away, and it's very worrying. And they tell my eyes are really dry. I'm dropping the drops like 3 times a day. I bought this other thing that said put it in that night when you go to sleep. I keep on doing that, but it's not helping at all.
Yeah, and it's not going to because those drops aren't meant to recover or restore anything. They're just meant to be like a band aid on the dry eye.
My days.
So Dana sent you a message with my phone number. It's probably in your direct messages on
Okay.
TikTok. Do you know how to get there?
Okay. Pardon?
You might have to leave the live to get you to your direct messages, but
Okay.
that's where she sent you my phone number.
All right then.
Oh
Okay.
wait. So Dana's saying that your account's private and she can't send you a message.
Okay. So you know what? My son, he actually made this TikTok thing for me. Because to be honest, I'm not like literally. So I go on it and stuff. So I let him.
Right.
He's gone off to school now. So when he gets home, uh, if I oh crap, what do I do?
So here's what I want you to do. Um, do you see my picture in the upper left hand corner?
I there's a picture up there, yeah, but
Okay, so I want you to click on that picture.
yeah,
It's going to open up another page with a picture. Click on that picture also.
yep.
Okay, then there's a link.
Hmm.
So I need you to click on the link.
On the other page. Okay.
Yes.
Hold on. Okay.
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 And did a page come up?
There's a. I clicked on a link. It says no. It only says subscribed or pick up with it. No. Okay. If I subscribe to it, then
If you subscribe, then you'll put in your email and your name. I'll have your information and I'll reach back out to you in a little bit.
okay. I'm gonna do the subscribe then. Okay. Oh, it's saying that it's unavailable. Subscription is currently unavailable.
Really?
That's what it's saying when I go on there. It's saying that it's currently unavailable.
I click subscribe, and it says club subscribe 10%, and then it's saying currently unavailable. Why? I didn't know that my son.
Hang on a second. Do you have a pen and paper handy?
I do.
Okay.
I do.
I want you to write this down. I'm going to try and do it and have TikTok not really know what I'm doing.
Okay.
Okay. So the first number is 7.
Mhm.
The second number is 2.
Okay.
The third number is 7.
Okay.
And at the very end,
Mhm.
so put a space, and at the
Okay.
very end, you're going to put 4
Okay.
and then a 1
Mhm.
and then a 3
Mhm.
and then another 3.
Okay.
And in front of the 4,
Mhm.
you're going to put a 5,
Mhm.
and in front of the 5, you're going to put a 1,
Okay.
and in front of the 1, you're going to put a 4.
Okay. I've done that. Yeah.
Okay. Now, do you have WhatsApp?
Yes, I do.
Okay. WhatsApp that number.
Okay. Cool.
Okay.
Yeah.
And while we're on live, because then you'll know you've got me and I'll know I've got you.
Got you. Okay. All right then.
Sweet Pea 1969. How do you get What's going on with your eyesight, first of all? And hang on. G9 fucking bear. They just want me to get surgery. My father is also blind. He had the surgeries and made it worse. Excuse me. Totally understand. What's going on with your eyes that they want you to have surgery for? You can come up on the panel and we can talk about it. Yeah, Dana, I know. I don't know how to, I don't know a better way to get the information because her account's private. I can't really.
Okay, well, since Dana. Oh, sorry.
I'm sorry?
Now I was saying since Dana is back, I'm gonna run around to get things together for work.
Okay. Have a fantastic day. Thank you so much, Pauline.
You are welcome.
All right.
Okay, Dana. She spoke off.
I'm sorry. I cut you off a little early.
Hello.
Renee, baby?
Yes. Is it my
Okay.
turn?
Yes, go ahead.
Hi, Leslie. How are you?
I'm excellent. How are you?
Well, I kind of would like your input on some things. Our eyes are very important to us. And as you get older, you start having issues, or you don't. I have had a lens implant about 13 years ago in my right eye, and it didn't work. It quit working about 3 months later. Then in
Oh, wow.
2019, yeah, I
Was
see
that
really
was that for a
clear.
cataract?
Actually, I don't remember what they said. It was so long ago. I was going through so much. I really didn't pay a lot of attention, but
Okay.
it was amazing for a minute. Okay. But then 2019, cataract, they removed the cataract on my left eye. Now, I've had uveitis in my left eye, and I have lupus and Sjogren's. So my eyes are like, oh no, dry. I've
They are
used
extra dry.
drops. Yes, ma'am. I've used eye drops, preservative free. I've used hexene free castor oil. But I'm still having trouble. But I have these little white things, these little milias that'll come up. Some of them are hard as a rock, and I've had skin cancer 4 times. I just want to throw that in there.
Okay.
I'm from Florida, but anyway, so anyway, these little melials will come up, and there'll be one over here on the top of my face or whatever, and I can get them off because I have so much oil on my face. Well, one time I had one on my eyelid, and I just squeezed it, and it came out. Well, on the eye that had the uveitis that I have so much trouble with, there's one that came up there. Now you can see that it's half liquid and half white. Well, I went to this specialist. He's supposed to be some whoopie doo, and he didn't really want to do a biopsy. He just wanted to do surgery and pull some skin, which freaked me out. Pull some skin from the sides of my eye to replace the skin he's going to have to cut out. Now I'm
Right.
horrified. I'm
Right.
horrified. I don't know if it's cancerous or not, and I don't want to be put to sleep. I've got two lung diseases. You know what I'm saying? Like I'm just
Right.
horrified over the whole situation. I make a pre and probiotic fermented juice, and I've been putting that on my eyelid just with a Q-tip, just laying it there, cause like, please do something. I'm just girl. No, I am telling you, I'm trying to work it. I am trying to work it. So I'm hoping maybe you might have some information for me because I'm losing sleep over this. You know what I'm saying? I don't want it to be cancer. I don't know if it is cancer. But he
Okay.
doesn't even really want to get in there first. Let's just see what we're dealing with. He just
Right.
wants to get the thing off because it is a pretty good size, not enormous, but it's the size of a fat pimple.
Right.
Uh, but it's on the bottom lid, and he's supposed to be the best. But he kind of freaked me out. Doctors here in where I live in Missouri, I don't trust a one of them. Not one. Not one. You
Oh
just
my
don't know.
gosh.
No, you don't know. I ain't gonna bore you, but it would blow your mind. Anyway, go ahead.
So is it actually on the lash line or on the lid?
Uh, okay, so show me the difference.
So the lash line
Put
is
this
like
right there together.
in the 70s where you used to put mascara. I mean, not mascara, but eyeliner, like
There.
on the waterline of the eye.
Um, both.
Okay. Here's what I'm going to recommend you do. You're going to get the 30/70 blend. This is DMSO and castor oil. Castor oil is going to help break it up. The DMSO is going to get deep enough into it to be able to break it up from the inside out and treat the skin. But you're going to treat your whole entire eyelid externally, and you're going to drop a drop in the eye.
Okay.
First, you're going to use the Revitalize, which is going to come with the 3070. You're going to use this. Come on.
Okay.
To hydrate the area and hydrate your eyes.
Oh, I love that word.
Yes. It's going to feel so good. You're going to be like, I got to buy this lady a car.
Can't
But
stand it. Whew. Girl, no, my eyes is on fire all the time, and I'm constantly putting those drops in there. I mean, it's just ain't it. Truthfully, come on now, it
no,
ain't
I
working.
understand. I understand. It
You
ain't working. And it's not meant to
can't.
work. It's
Yeah, I
meant to
know
have
that.
you doing what you're doing, putting them in
Yeah.
constantly.
Okay.
So we're going to hydrate your eyes and then we're going to treat the eyes so that we can solve this problem with like the little cysts that you have now,
Yeah.
and so they don't grow back.
Ooh. Because this is the first one I've ever had like this. Because the other ones, like I said, I just squeezed them. I figured I would just squeeze that, but I've been so sick with lupus, and I'm on a medication for weight loss. The combination, my body's just constantly fighting inside. I ain't had time to think about nothing else. And then one day, it's like I went to the dermatologist because I've had skin cancer, and I get checked every 6 months, three
Right.
times. And he said, "Hey, you need to go get that eye looked at." And my heart skipped a beat or two. And I thought, oh my gosh. And that's when I went there, and he just didn't even want to. I would rather try it your way. That's all I'm going to say. I'm going to try it your way. Okay? Because
I
I don't
think
trust no doctors.
no, I think
Sorry.
you'll be surprised at the benefits that you're going to receive all the way
Okay.
around.
Okay. So just go on your link tree there.
Yeah, just go to the do what it says up here at the top. If I say the words, TikTok's going to ban me.
Yes, ma'am.
Um, so just go there, and you can click on my
Oh,
picture here,
yes,
and
ma'am.
then
I know how to do it.
you know how to do it.
Well, yes, ma'am. I'm good. I'm
Yep,
good at it. I'm an
100%,
addict. TikTok shop loves me, honey.
100%,
Woo!
100%. So yeah,
Okay,
no, go
boy.
there, and you're looking for the 3070.
Okay.
Okay.
All right, I'm gonna do that, and I'm gonna come back and let you know. Like, how long you think it might take before I would see anything happening, or
2 weeks.
2 weeks? Okay, so I'll see you in 3.
100%. 2 weeks in one day.
Okay, then. Now I
100%.
don't even know what to think. I'm like getting excited for once.
You should
I've had
be.
I've had a long struggle, honey. I'm not lying. It's been a long, many years. And then doctors, they don't know what to do or do nothing. And then they just want to do surgery and pull my skin around my eye, girl. That's going to make me look like some kind of freak. Oh, I can't be doing that
I
now.
just don't understand why they can't slow down long enough to tell you the whole story so that you can really understand
No,
what it is they're trying to
didn't tell
do.
me nothing. And I left there thinking, she's I got my ass out of here because I ain't coming back. No.
No,
I was,
100%. They're
I was out of it. I couldn't take it.
gonna
So I
have you looking
found
like
you.
Cruella Deville.
Girl, how am I gonna do? Am I gonna be wearing a patch or something? Try to be sexy. I make bling vases, so I thought, well, heck, I could bling it out. And I'm thinking, what am I saying here? That's not even funny. I got to do something. And I've been seeing your TikTok for a long time, and I've cruised through there, and I'm like, well, wow, what's she talking about? Because I love being able to scroll around and see different things. I've learned so much from
Yes.
doctors up on here. So it's like, you know what? Tonight I seen you, and it's like, oh my, she might know something. But not only do you know something, you know a lot.
Well, thank you for that. I appreciate that. But you'll start to see results fairly quickly, and it will feel so much better. Your eyes
Okay.
as a whole
Okay.
will feel so much better, and that
Okay.
will be a game changer.
That would help my life. So I'm really in a lot of struggles. I'm tired of one more and one more and one more and one more. You know what I mean? Like, I need help. So I'm gonna go take care of that and check it out now. And thank you for talking to me tonight. I really appreciate you.
No problem at all. No problem at all. And I'm on live on TikTok from 7 to 8 p.m. Monday through Friday. So you can come talk to me anytime.
Okay, yes, ma'am. Thank you so much, and have a wonderful. I guess it's daytime.
It is finally daytime. Like it is starting to be daytime.
My husband works nights, so I talk to him on the phone at night. So we're up all night until that changes. We're up all night. So this is
Yeah,
like our. So anyway, all right. Thank you, Leslie. Take
you're
care.
more than welcome.
All right. Bye bye,
Bye
honey.
bye. Okay. A Cassaforning.
When you say that you restore cataracts, could you explain what that means?
Well, I restore eyesight from cataracts, so it actually dissolves the protein material that is situated on the lens of the eye inside the vitreous fluid. So that's what I did for myself, and that's what I've done for many others with the castor oil and DMSO is dissolve that protein buildup away from the lens of the eye so that you don't have to have cataract surgery. Dana, aren't you playing pickleball at 8?
I plan on being there by 8. Leslie, God won't let me go to sleep, I swear. I have been praying. I've been praying for your strength and for all of that and all the people around me and just different things. And I swear to God, I've been trying to go to sleep and I cannot. So I'll just be getting up when my clock goes off at 7 and see what the rest of the day has. Maybe I'll take some cat naps. I slept about 2, 3 hours, but before I came in at 2, because I had set my clock. I think I might have laid down about 11, 10 or 11. I don't know. And then I set the clock for 2 o'clock. Uh, Focus said that they had added you to their WhatsApp app now.
Yes. And my phone didn't ring, but I see the text message and I just texted back. So we are now connected on WhatsApp.
All right, we got it. Thank you, Renee, baby. I see it. You're welcome.
It is unbelievable.
All the stuff that I'll be sending on the DMs, it pops up on the screen when they reply, so I can see it come through.
That's awesome.
Hmm.
I might have to close my eyes for 10 minutes. Like you can't go to sleep and I can't stay awake.
Get up and go walk around. Go. The sun hasn't come out yet, so you can't go sun gaze.
No, not yet. It's coming though. It's coming. It's getting light outside. I can see through my window. It's
It's
getting
really
light
cold
outside.
here. I heard you say you cut on your heat in the car yesterday.
Yes.
She says, so I can contact you when AM there?
Yeah, when you're there. When you're here, call me. 100%. 100%.
Hmm. Did
That's
any of my
actually
did any of
what?
my people call did any of my people reach out to you that I gave the information to?
Nobody that said, Dana told me to call.
Okay. No. It's just people I'm trying to get out of the middle of,
No, I understand. And
and I
it's
want them to do the process so that once they redo, they can keep getting it themselves. Because you know what just happened to the last thing with my stuff. They came here, brought me the box. I just got the box today.
really,
And I was going to tell you, I opened it and it had been opened or something. And just something didn't smell right. So I threw it away. I was just
really?
scared. Yeah.
What
Because they've
was,
had it for all this time. Remember the one that went to Texas?
yeah.
So maybe it was sitting in heat, or I don't know, but it was someone right.
Well, text me what the order was and I'll replace it for you.
No, you already did. You already sent me that. I'm using it now.
I did? Oh, okay.
Yeah. Mm-hmm.
All right. I am going to take your advice because right now there's a lull. Like,
Okay, well, go ahead. I'll hang in here and talk.
excellent. Do you want me to put music on or just leave
No,
it?
it'd be too loud. Unless you could do it real lightly. I
No,
think the
you can't.
music helps bring it in too, helps bring people in too.
Yeah, it doesn't let me change the volume though.
It doesn't at all. Because it's
No,
hard for me to talk over it.
I'm gonna try it one
You
more
don't have
time.
ALEX in the background that you can turn on?
No, and
No?
you can't use music that's copyrighted.
Oh, I have it on my live. I ain't never had no problem. I just have it low in the background, like it's in another room, but you can still faintly hear it.
I found
She
the
said,
volume.
should they make the order before they come?
I would make the order before you come so that it's ready when you get here.
Uh-huh.
And you don't
Which
have to
eye
wait
drops do you use for floaters? You use the 3070.
3070.
I can tell them some of the stuff.
No, you know a lot.
Yeah, I do. I do. It just it flows more now than it used to. Go ahead, take a few minutes. Everybody, we got 50 people in the room. I'm gonna start calling you out. Focus says, how do I do that? Thank you. How do I do what? Focus. Place the order?
Oh, she needs to get to the site. I'll tell her I'm gonna text it to her.
She's gonna put it to you on WhatsApp app or whatever. Text that, yeah. She said thank you. Triple said thank you. Triple treat. Okay, everybody. I need some movement. We're gonna give Leslie a few minutes to do what she needs to do. And I can't go to sleep, so God got me here for some reason. I need you guys to let me know where you're watching from. There's 48 people. Some of you guys might be asleep, might just be having it on and listening. We got 144 shares. I'm going to walk you through how to share right quick. If you take your finger and hold your finger down on your screen, on the eye, names will pop up. It'll say report or repost. And then it'll have names. You can go down your list and click all those names and it will start sending it out. Let's see if we can get about 300 shares out really quick. If everybody could just put your finger on the screen, the names will pop up that are your people that you follow or are following you, and friends and family or whoever, and just start sending, and TikTok will do all the work for you. Hi, Ann. Thanks for sharing the invite. And do that. And then thank you, Joanne, for letting me know that you're in Boston, Massachusetts. Thank you, thank you, thank you. All right, we're up to 145. One person's done it. I'm getting you guys moving around and active this morning right now so we can give Miss Leslie a little bit of time. She's trying to do 24 hours of information about that beautiful eye, about our eyes. And I can tell you a little bit about how I met her. If we can get these shares up to 200, I'll tell you my brief story right
This
quick.
is a good story, you guys.
Okay, Leslie, be quiet, go to sleep, nap for a second.
I'm just gonna
I
go
have used organic castor
walk around.
oil in about 5 months and no change. Organic castor. Okay, you're probably going to be needing to use Miss Leslie's Bearcat Body Eye Drops. And it has a DMSO in it, which helps penetrate the eye and it gets the castor oil deeper into the eye. So just hit on the Bearcat Body up top, go to her link, and you can order your products through there. If you need more information, come back, within about half hour or so, and she'll talk with you and let you know what product would best work for you and your eye and whatever issues that you're having. Thank you, Pink Room. You're in
Hey,
Jamaica. You're in Jamaica. Yay. Okay, we're not sharing. Everybody, let's share. We're only at 147. I need you guys to participate. Really help me out here with some activity going on. If you're not tapping on the screen and you're not writing in the comments or you're not sharing, then TikTok thinks we're not doing anything. She's been on live now for more than 6 hours, almost 6 hours. So it's 5:54 Eastern Standard Time right now. So we need to really get those likes up. I see we got the red hearts up there, plus 41. So thank you for the hearts. I see them going. I see them going. Thank you. Thank you, Focus. So my question has been, let me know what state you're watching from or city. Share the live or tap the screen. And once we get up to 200 shares, I'd like to share my story with you about how I met Miss Leslie. And now 9 months later, life has changed. I've been there to meet her in person at the warehouse. Sent out the first bottle to a gentleman named Keith or Eric, I think, and he was in Michigan. Did he ever come back and report that he received the package, Leslie?
yes.
Okay, I wasn't on the live that day. I didn't get to hear it. Good. So that was my prophecy to her back in March or April, I think, that she would have a warehouse before the end of the year. And when she got it, I would come and send out the first bottle. And I was able to do that. And I'm in Ohio. So that's just a little bit of the story, just a tease. So I'm still seeing we got 41 people in the room, 13.5 Ks. And I love that jazz. Maybe that'll help put me to sleep. Everybody who's ever awoke and paying attention, can you put a 1 in the comments? I just want to see really how many of these 40 people are listening and interacting. That's really hard to get people to do. It says YouTube beauties is no coincidence. That situation worked out the way they did. I remember I hated typing in the comments, and I was like, "Hey, bring me up. I can't put all my information in this comments. I need to be talking." And she was like, Leslie was like, "I don't know how to do that." I was like, "I'm gonna walk you through it." And now she has people come up on the panel and everything else. Nope, nobody's interacting. I think they're asleep. We can do this. You must be making your coffee. It says we fight for your sight. Hello, Sunshine and Y Nash. Focus. Hello, 1738. Hello, Pauline and Margaret. Renee, baby, you're still with us. Naomi and usually 8466. Hello, Angela. I haven't talked to you in a while. Sherma, Ingo Beauty, Worship Him, Cheryl Pittman, Susie, Tala, La. Ooh, I can't see that. Say that. Busaidy. Luluhu, Cry Loud, Zappa, Rodney, Marlo, Phyllis, Vic M, Pink Room, Dina Girl, TikTok Famous Granny, hey, Flavor F, Roderick James, Linda Lee 72, hey Gigi, BOYES, Lynn 5252, hey Blissful Journey, Vanessa Sharp, and Leon Taylor 73. Thank you all for just coming in and hanging out with Bearcat Body for these next 24 hours if you can hang. We thank you, thank you, thank you. Those of you who are not in the room and just outside looking in, come on in. Let's have a conversation. A lot of information. If it's not for you, it could be for a friend or loved ones. I tell people all the time that you could be a blessing today for someone just by sharing the information. Okay, it's 6 a.m. Eastern Standard Time.
Woo woo.
I see some light out my window. Not any sun, but I don't know what the weather's supposed to be today. I guess I'm gonna have to ask Alexa
Ask Alexa.
what the weather's gonna be today.
I'm glad I found the volume because that certainly makes this music tolerable.
Oh, you didn't? I figured you did something.
Yeah.
Okay, Alexa, I heard you. It said, don't forget to take out the trash can. Today is trash day.
That was me yesterday. Reminding my
Oh,
daughter.
somebody's doing it. Somebody came in. Thank you. I see you.
Hey, 1738!
1738. Thank
Yay!
you. See, I called them out. Now they're pushing that button. There we okay, I'm gonna tell the story. Almost at 200. It made it to 184. They did it. All right. We got almost up to 200 shares. Okay, well, this is how I met her. Real quick. So I've been on TikTok. Oh, she went over 200. Thank you. I been on TikTok now for probably almost over 5 years. And if you don't know me, go to my channel and subscribe to my channel. I've been trying to get to 10,000 followers for over the last year. I've been stuck at 9,000 plus. And I just finally kind of gave up on that. I'm like, okay, God, what am I supposed to be doing here? But anyway, so I always go into different rooms and listen and tap up the screen and all those things that I've been trained to do over time because I do lives. And so I was going through swiping like most people, swipe, 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 and I came across Barbara O'Neill. And she was talking about putting castor oil in her eye. And she stood there and she dropped some in her eye and she rubbed it all around her eye. And I was talking to the screen saying, you got to be kidding me. I'm not doing that. Why would I even think to put some oil in that makes no sense to me. So then about a week later, I ran across one of Leslie's posts and she was talking about the Jamaican black castor or the DMSO to put in your eye. So I'm going, what? So I go to her page and literally I go through probably, let's say the first 50 posts of hers, because that's sometimes what I do. I'll go to their pages and look at their posts, see what they're talking about. So then I would say maybe a few days later, again, I ran across Barbara O'Neill, but this time Barbara O'Neill stitched a video of Leslie's. And when she came back, she said, I've been telling you guys for years to put the castor oil in your eye, and this lady right here has come up with a formula to help your eyesight. I'm like, oh my God, this is for real. This is a real thing. So then I guess because I had joined her page, I got a notification she was on live. And I came in and I was listening. And this was back in January. And I started, of course, writing some stuff in the comments because I had questions and stuff. And at some point, I pushed the request button at the bottom, the little pink and the blue people. And I told her, oh, no, in the comments, I said, I want to come up. I want to talk. And so she was like, I don't know how to do that. And I said, well, I'm going to walk you through it.
Did not know
And
how to
so,
do it.
right. She said, I don't know how to do that. I said, I'm going to walk you through it. So right on live, we walked her through it. I walked her through it. She pulled me up and I started talking. And I was just like, I was really God led, I believe, because I told her, I said, look, I can see and hear what you're trying to do. And it's going to be hard for you to answer questions and do everything at the same time. I would love to be a moderator for you. I said, she says, oh, okay.
I
And I
said,
said,
what's that?
yeah, you was like, oh, well, you
What's
knew what
that?
she knew what moderator meant, but she was like, and I said, what I would just be here on the sideline and I can help answer questions in the comments and direct people and stuff like that. Just direct your traffic and stuff that's going on, free you up some time, you know. And then I said, I don't really have a lot of eye issues. I said, I'm nearsighted. I have astigmatism in my left eye, and I've been wearing glasses since I was 6 years old. I said, and then I guess we got to talking, and she says, well, then she told me what she thought would work for me. And then I was like, okay. And then she told me what to do, and she sent it to me. And so I just start coming in every day, which this is when she did it every single day. She was coming on live every day. You know, some days life happened or something, but most of the time she was there every single day. So when I got my product, when it came, I text her first. And then I said, oh, well, she probably didn't get the text. So I tried to DM her to tell her that I had got my product, but I was scared to use it and I needed her to walk me through what to do. But she didn't get it. And then when I came on live and I came up, because I didn't want to say all that stuff on live, but then the thing ended up being just being honest and saying what you felt and where you were at was the best tool that you could have ever used because it made other people more comfortable. And that's how I ended up starting to do the demos. But anyway, that day, I told her I had the eye drops and everything, and I was scared to use it. So what I did at first, the night before I saw her, I rubbed it on my eyelid because she had talked about us. You could put it on your eyelid, but it would take longer for it to penetrate, you know. But by putting it in the eye, it'll work faster. So I told her, you know, I got to work my way up to this because this is all foreign to me. So anyway, I ended up saying, well, can I show you what I'm doing? And I showed her how to pull me up on the screen and I put the drops in my eye. And so they were stinging. Ooh, they were stinging. I was calling burning, you know. And then at the time, but I realized the difference between burning and stinging, you know. And so I stopped calling it burning and referenced it as a sting. And that went in. So then when I got in and she told me, she says, what I'd like you to do, Dana, is to stop wearing your glasses and start letting your eyes work for you. And so I did that. And then I was an eyelash girl back then, where if you go back and look at any of my posts, you'll see eyelashes. I always had and they weren't the big gaudy flash ones or nothing like that, because I would wear like brown or whatever, but it just always highlighted my eyes. And I started telling her, I said, well, I don't want that glue to go deeper into my eyes, so I'm going to have to stop wearing my eyelashes. And she was like, yep. And, no makeup, when you're putting your eye drops in. I said, well, I don't really wear makeup, just my eyelashes really and lipstick. So I stopped wearing the eyelashes and I just started doing the eye drops twice a day, in the morning and in the evening, in the morning and the evening. And I'm a pickleball player, so the very first thing I noticed about a few weeks in was I could see the people and the ball clearer. Now, anytime I would leave to go to play pickleball, and if I had forgot my glasses, I would turn around and go back home to get them. But as the time went by, these are weeks in the first months, that this was happening. And so from that date on, I've never wore glasses or I forgot about the contacts or contacts. So I have hundreds of dollars worth of contacts sitting in my medicine cabinet. I have 2 different prescriptions, my glasses that I don't wear, the sunglasses, the ones that get darker, and then my prescription with the what you call it for up close, the bifocal on the bottom. And my readers, matter of fact, I just took some readers and put them in a little thing so I can give them to somebody else who needed some readers. But, so then, like, what happened after that? My story is so long. After that, I just would come on and do 2 or 3 times a week. I'd come in and do demos, and that's where we met Deb and a whole bunch of other people that were coming in and were scared just like me, about, I want to try this. I know I didn't come by this message or by this eye by mistake, that it was a blessing that I was able to see it and come and hear the information. And so me being the type of person I am that I just talk about everything and share everything, quite a few people just in my circle and outside of my circle have purchased her product, are using it, and telling other people about it. And that I was able, after I prophesied like in March about her, that's how confident I was in her product, and watching and listening to the other people that were being helped, that I was telling God, I said, I know she can't keep doing this out of her house. She was in Florida. And I just kept saying, you're going to have a warehouse before the end of the year. And I'm going to come. And I want to send out the first bottle. So when July came, and my life was really busy with remodeling of my kitchen, my front porch, and I had so much going on, and Leslie had changed her time of coming on that I just never got to come into the live that whole month. And one day I was sitting on the front porch that had just got finished being remodeled, and I got a notification that she was on live. And so I tuned into the live, and they were just talking, and I was just listening and everything. I didn't even let her know I was there. I hadn't started tapping or sharing, because a lot of times she'll see that I'm there just because I come and tap. And I go into any live and I tap up 1,000 always. That's my goal, is to go in and tap up 1,000 hearts and as many shares as I can. So I said, hey, bring me up, because they were on there talking about a warehouse and moving to Atlanta the next week. And I was like, well, I only been gone a month. So she brought me up. I was like, wait a minute, what's going on? What's going on? And she started laughing like she's doing now. And she was just like, yeah, Dana. She said, I got to work. I'm like, warehouse. And I'm thinking Florida, right? I'm thinking Florida. That's where the warehouse is at. Well, no, it's in Atlanta. I said, Atlanta? I was so outdone. I was like, what? And she's, then she tried to tell us a little bit about what's going on. I see you, Pink Room. I was scared too. I had the product for 2 months before I got I know, because I talked to you and I said, go in there, get that product out of that cabinet. Let's do it right now on live. I was like, so many people we were able to bless like that, just because they were just, like I used to call them, regular people. So anyway, back to the story so I can finish this. So then I was like, well, I told you I was coming. She said, I got you. She said, talk with Coco. We're going to get you here. She said, clear your schedule because it's on August 2nd. And this was like July 20th or something like that, or 25th. And I was like, clear my schedule. Oh, it will be clear because I will be there. I will be there. I don't care what's on my schedule. It's going to be pushed to the side because I'm coming. And that's how I ended up going. So if you want to see the 4 days I was there, I did a follow me thing on there on my page. And you could see her how when she first saw me. And it was so funny that the second day when she saw me, the only reason she knew it was me was by my voice because I changed my hair. I
Yes.
cut my braids out and I came in with a blonde wig on. And so when I peeked in the doorway, she looked at me like, okay, hi.
I'm like, what happened?
But yeah, I had a wonderful experience and you can see that. And then it was just wonderful. It was like for me, it's just it was just hard to imagine that that all happened to me because I met somebody on TikTok and that I really believed in what they were doing. And I prayed about a lot of it, you know, and God just kept sending me information and signs and people, when they found out I was even flying to go in there, they was like, you doing what? You doing what? You going where? To somebody you met how? Oh, it was crazy. It was, but when you know, you know. And when you're blessed, you're blessed. You know, and when it's working, it's working. And I had all those things in my favor. And so I think that's why God's got me up right now all night with this woman because I love her, first of all, for so much, you know, just for being a blessing. And she took a gift that she had and sharing it with the world. And if I keep talking about it, y'all, I'm going to cry for real because how many people do that? I don't know if you guys know how many people she is just blessed with the stuff, okay? Not financially, you know, just pay me. No, here, this is, and I walk around doing it all the time. I keep the bottle with me. I drop it in people's eyes. I take the 75/25 and rub it on people's backs and on people's knees and everything I have. Because I just, I know it to be true, and I know that all natural is the way to go. You don't have side effects from this stuff, you
The
know.
side
So
effect is good eyesight.
yeah, yeah. That too.
That's the side
That'll
effect.
be another one of my lines. That'll be my new line. Right. Yeah, that'll be my new line. Well, I guess you hear my nose has stopped there because I'm crying already. But that's the gist of my story, you guys. And
And the thing that she hasn't said yet,
oh,
that she uh, alluded to but didn't say out loud, is she has been glasses free and contact free
right.
for months.
Yeah. And that my
Months.
glasses that you see me wear now are just my accessories. I have about almost 30 pair now, and I just accessorize them with my wardrobe. And that always gives me the opportunity to talk about the eye drops when people compliment me on my eyes because I'll just lift them up and say, these aren't even real. I don't wear glasses anymore because and that's how the conversation gets started. Yeah,
Exactly.
yeah.
Exactly.
But
They're real glasses, but they don't have a prescription.
nope, no prescription. And another thing I do is I take the old glasses and I put them up to my eyes and I look at something and then I take them off and I don't have 20/20, but the only thing the glasses does is make it more sharp. Maybe that's the best way I could say it, sharper. But I still see the same things as though I had the glasses. So my eyes have what I say is my eyes have caught up with my prescription. And like the readers and stuff, oh, I can't even put those on because that's just so blurry, you know. So and now I'm in a maintenance program also for myself. I don't even do them every day. I do them every Sunday for sure. That's my one day. Every Sunday I put all of the drops in my eye. And then maybe Wednesday, and I'm not putting them in because my eyes are dry or anything like that. I put them in because they're in my refrigerator, and when I open that door and I see them, I'd be like, okay, when's the last time I put some in my eye? Because I just want to keep a maintenance for myself to keep them where they're at or if they can get any better. But yeah, that's my story and I'm gonna stick to it.
It's a great story.
Yeah.
It's a great story. And the end of the story is your glass is free
Yeah.
from getting glasses at 6 years old.
And I forgot to tell you that cloudiness that initially we started with, it's taken all this time to pretty much make it. Now that I'm thinking about it, I don't see it. So the I didn't tell him this, but it was prevalent at the beginning where there was like a cloud over my left eye that has astigmatism in it, but I didn't know what it was. And like I was telling her, that was the only problem I really felt that I had with my eyes because I didn't feel like wearing glasses was a problem for me,
Right.
because I could still see as long as I had my glasses around me. So I didn't look at that as a problem. So the only problem that I really thought I had was this little cloudiness that would kind of come over the left eye. And so then she sent me the foreign eye 2. And the reason why I did the foreign eye 2 is because I believe she made it for my sister because my sister was allergic to sulfate. And so when we start talking about that, then the next thing I knew, she came up with foreign eye 2, which means it didn't have the DMSO in it because if you're allergic, is it sulfate?
Sulfur.
Sulfur. If you're allergic to sulfur, then the DMSO may affect you. Not good.
No, it will, because DMSO is a sulfur-based product.
Okay. So, but now I don't even see it. Sometimes I would just kind of turn my head to the left or right to make it kind of like move away or go away or what. And I don't think I know it wasn't a floater. The floaters I had used to have were black lines that would wiggle or little dots. And I'd be swinging at them like it was a bug or something. I was like, what the heck? And it was scaring me at first. Floaters ain't no joke. Floaters make you feel like something is really bad going wrong with your eyes.
Yeah.
Yeah.
Or your brain. One of the two.
Main thing is I'll see people wiping their eyes and I'll say, you have dry eyes. I know something that will help you. Yeah. The doctor,
1,000%.
huh?
I said 1,000%. It'll help you beyond what you can believe is possible.
Yeah. Mm. What does it say? I have tried to tell my dad about you. He had an eye appointment yesterday, has cataract. Yeah, you know what, Michelle? It's hard to tell people about this kind of stuff because if we think back to how we were when we first heard about it, we have to relate that to other people. And I just pray about God showing a way through them. It might not be us to help them see what we want them to see. We want to fight for their sight. What she has right up there, we fight for your sight. And that's what we are doing. So don't give up on your dad. Just ask and pray for another avenue or another vessel to be used to bring him to this information. Because sometimes our family just doesn't hear us. They really don't. And we only, we're only telling them because we want to help them. Before I got this extra wind of waking up, I was praying for somebody who is actually blind, really legally blind. And the wife ordered the stuff, and then the husband had some issues, and then they decided not to use it. And every time I see him at church, I just pray. I just kind of reach my hand out and pray over him because I so want him to have his eyes back, but I can't do nothing about it. I can't drop the eye drop in his eye.
No,
So I,
100%.
I just
And
pray that God uses another vessel to get to them, and that's all I can do.
yeah, sometimes we get comfortable in our dysfunction.
Huh?
I said sometimes we get comfortable in our dysfunction.
Oh yes, I hear it all the time. I hear it all the time. Somebody says, "How do I start?" What would you like to start?
Well, the easiest way to start is at the beginning. And at the beginning, you gotta purchase the drop that matches your needs. What do you need?
Oh, it's 6:23. Let me take a break right quick too. Let me go. I brought her up. She's up there.
Oh, sorry.
Okay.
Wait. I'm in bed. I'm gonna get up. My husband is still sleeping. Okay, so my daughter, she's 13 and she has astigmatism. She's had it for a while.
Okay.
So she does have glasses also, but she doesn't want to wear them. Like she's what you were saying earlier. I'm sorry, what is your name? The person that was just talking?
Well, Dana was just talking, but I'm
Dana.
Leslie, and
Yes,
I'm the
hi.
owner of Bearcat Body.
So what you were saying, Dana, about not wearing the glasses
Yes.
that Leslie told you. So my someone told my daughter that don't wear the glasses because the glasses hinder you. Like just make your eye work for yourself. So she doesn't like to wear the glasses anyway. But she hardly can't see from far away. She just doesn't
Right.
want to wear the glasses. Um, my son has glasses. He has the contacts also, and he's 14.
Okay.
So he wears glasses and contacts depending on what it is. Me, let me see. I don't want to say I'm not that bad because I remember one time not wearing glasses and now I wear glasses. So I would like not to. My husband is
Okay.
fine. He doesn't wear anything and he sees fine.
Do you have any issues in your eyes other than just not
Except for
seeing
not
well?
seeing. Yeah, no, just not the, like I mostly wear my glasses when I am driving. I mean, I have the GPS that has a big screen, so I mostly use that. But if I want to see one of the signs, like the green ones, I have to put my glasses on.
Okay. So you need the 30/70 without a doubt.
For me, for myself.
Yes.
Okay.
For your use, you need 30/70. And you said your daughter's 13? Okay.
Leslie, I'm so happy that I took the time to tell my story if we just blessed one person. But look at this. She's saying three people: her daughter, her son, and herself.
Exactly. Exactly. So, but I don't know what happened. She's not.
She either got a phone call or she's writing something. It took her away. She'll probably be back because it doesn't show that she dropped down.
Oh, I went to your page. I went
Oh, okay.
to your link
Okay.
tree to see so I could take a screenshot of the ones that you're saying.
Okay. So yeah, for you the 30/70, and
30,
your
30,
daughter's
20?
just in the cusp of leaving the juvenile, coming into the adult. So
Wait, can you say for me again? 30 what? 30,
30/70,
70.
30/70.
Okay.
Ah,
Okay. And then my daughter?
so and you said she's 13, right?
Yeah, she just turned 13 in August.
I'm sorry. I gotta do this puzzle. For,
And she has astigmatism also that on one eye. I think it's the right eye. So the doctor had been telling her to cover one eye, or the one that's not lazy, to make it strong. But that is like difficult for her. I mean, but she has done it, but I still see a little bit that the eye is lazy.
so she's got lazy eye and astigmatism are two different things.
Yes, correct.
So does
Um,
she have both?
she has both, yes,
Okay. And she's 13 years old.
and she's 13 years old.
Okay. And Yeah, I think the 3070 is going to be the right answer for her too.
Okay, so both of us.
Yes.
Okay, good. And Rebecca. And then my son is
Microphone.
the
Yeah,
he
something's going on with your microphone because it kind of feels like you're in a tunnel. Sounds like you're
me?
in a tunnel or something. No, we're talking to Leslie. Hold on a second.
Oh,
Okay, is that better?
yes.
Okay,
It's all
good.
awesome.
Excellent, excellent.
Okay, so your
So my
son,
son Jacob, he's 15, 14. He's gonna be 15 in January. So he doesn't have stigmatism or lazy eye. He's just basically like blind. Like without glasses, like Dana was saying, he sees very blurry. And when I first during COVID was the first time that we realized that he needed glasses. And when he we put it on, he was like, "Oh, that's how things are supposed to look."
right,
Literally, that's what he said. I'm like, "You couldn't tell me that before that you couldn't see?" But he didn't know how to tell me because he was still little.
right. No, and it sounds like he needs a 3070 too.
Okay, perfect. So then I'll just get three.
Yes, and you'll get three revitalized, so everybody's eyes will be moisturized and hydrated and feeling great.
Oh,
And
revitalize 37
yes,
and then revitalize. Okay.
well, you get the revitalized for free, so it's
Oh,
automatic. You're gonna get that. All you're
okay,
gonna
cool.
purchase is the 3070, and you get the revitalized for free, and then you just have to drop the drops. And I'm going to recommend that you're just going to do, for you, I would recommend you start with 3 times a day.
Okay.
So you're going to do 2 days of just the revitalize, everybody.
Oh, so I start with the revitalize?
Start with the revitalize, and you're going to do 2 days, 5 drops a day.
Oh, 2 days. 5 days. 2 days. 5 drops per day. Perfect.
Yes.
That's
And
for
then
me.
on day 3,
Mm-hmm.
you're going to use the revitalize, and then you're going to use the 3070, one right after the other. And you're going to do that. You are going to do that 3 times a day.
Mm,
The kids are going to do it twice a day, morning and evening.
okay. All right. So just to repeat that, so I use the first week, I guess. Use the revitalize twice a day for 5 days.
Nope. You're
Oh,
going to use it 5 times a day for 2 days.
oh, 5 times a day. The first week.
Yes.
First week. First week. Oh, I have to take this
Okay.
place. Hold on, I'm writing in this thing here, but I have
Okay.
to take it. I have to take it out. I had to come back.
Okay, so Leslie, I hear her keep saying the first week, but you're actually telling her the first 2 days just to do the revitalize and then add in the 3070.
Yeah. So for 2 days,
Day
you're going to
three.
use just the revitalize 5 times a day each day.
Right. Yeah.
But she said 5 times a day.
Right.
Oh, five
Five
times for
times a
2 days.
day for two
For
days.
Right.
Thank you for clarifying that because I was getting confused too. And then for the kids, I'm just gonna do um 2 drops a day.
Yeah, you're still gonna do the 2 days, 5 drops a day.
Oh, for them too.
So
Okay,
you're all gonna do that. But then you're gonna do the 3070 and revitalize 3 times a day. They're gonna do the 3070 and revitalize twice a day.
perfect. Until the bottles are finished.
Until you get the results that you want.
Okay.
So,
Got it.
for instance, in Dana's experience, she got to the point in like it was like 90 days that she didn't need her glasses or her contacts anymore. So there's no need to keep putting, drops in your eye every single day. Now she's got these backup drops. She's in a maintenance program. A couple of times a week, she drops the drops in her eyes, and that's it.
Mm. So then after, Dana, after the stinging that I think you said, after the first week or whatever, like how long did it take for it to go away, or do you still feel the sting?
It it kind of it's okay. It depends on your environment. It's a lot of things that make your eyes dry and the product to come to sting. So a lot of times, no, like I'll put the revitalize in, and then I'll go right back with the 370 in it. And all I feel when I put the 370 in, 3070, I'm sorry, before I felt a sting, now I feel the warmth. And what happens
Oh,
is
it
when
feels
you
warm.
drop it, it's like really warm for about 3 seconds, like really warm. Now that maybe the next week, maybe I had been in the desert, I don't know, doing something, and my eyes were drier, and I might feel a sting. But the sting in my eyes would just kind of water up or whatever. I'll blink them for a little bit, and I'm good to go. But yes, in the beginning, for me, it depends on everybody. Everybody's eyes are different, how dry their eyes are. I had a significant sting, and I would actually do it on live, and I would tell them, I would count down, I'd look at the clock, and I say, okay, right now it's still stinging. You see me, blinking my eyes, and they're watering, and now it's starting to go away. I would just kind of walk people through what they might be experiencing also, because I knew it was a scary thing. I knew I wasn't the only one that felt like that, but I didn't want them to miss the blessing. That's what it is. I've seen so many people miss the blessing in it because they stopped, because
Hmm.
they couldn't get past the sting. And I stopped calling it a burn. That was another thing right off the bat. Those two things are different. A burn is where it scars your eyes, is bad. A sting is something that, think about like salt, like you go swimming and you get out of the ocean and your eyes are kind of stinging because of the salt that was in the water.
Yeah.
So, oh, that person got to be put on mute.
Okay, yeah,
Okay,
that definitely helps. I mean, I'm not
okay, that's
sure. I'm not sure if it's best to tell them before that it's gonna be a little warm
yes. It's best to
Well, yeah,
let
but
them
it
know
is
what's
best to
going
let
on.
them know what to
beforehand.
expect.
Right, because they won't do it. They won't keep doing it. They won't get the success out of it because they'll stop.
Yeah.
So, yeah, it's best to walk them through it. It really is.
All right, I will
Yeah.
do that. Thank you
Okay.
so much. And actually, when you guys started talking about it, when you say castor oil, and I have listened to Barbara as well, and I know she's very good. But when
Mhm.
you first say castor oil, I'm like, how the heck you gonna put castor oil in your eye? But then when you said drops, I was like, okay, that's makes sense because if you rub castor oil is very thick. Like we put castor oil in our hair and our scalp,
Yeah.
or
Mhm.
in in my eyebrows and stuff. I don't do it all the time, but I do.
Mhm.
But once you said drops, I'm like, that makes more sense. So,
Yeah.
No,
Okay.
100%.
Well,
Yes.
listen. Well, thank you. I'm so glad I shared. I told Leslie that.
yeah,
And
thank you.
I just always believe it's a blessing, and I believe God uses us to be a blessing to many. So
Agreed. Amen. Amen
please
to
come
that.
back and let us know as things progress with you and your children, because you're going to be blessing even more people because of your story.
Yes, I am definitely gonna come back and do it. I am gonna order, I'm gonna be honest. I am gonna order one right now
Mhm.
because how long would one last um
If you
uh,
were using it,
the dosage that you
yeah,
mentioned?
if you were using it twice a day, the revitalized and the 3070, it would last you 90 to 120 days.
It will last how much? How long?
90 to 120 days.
Okay.
Something's
Because
happening.
I can buy one like I can buy them now, but then Friday I get paid again, so I can buy another one on Friday.
Okay.
I can't buy them all in one shot. I
Yeah.
literally just spent money yesterday that I really had to. So,
Oh,
but
no worries.
I I need this too. So I'm gonna go and get one now.
Okay.
Thank you so much both for your time.
No, you're very
I
welcome.
shared it to two of my friends, so, but I think
Excellent.
they're
Thank
probably
you.
sleep. They're probably sleeping.
I am, along with the rest of the world. What are we doing
Yeah,
left?
but guess
No,
what? When
this
I
is
wake
good.
up, she'll still be here because she's doing a 24-hour
Oh,
run.
really? Okay, perfect. So
Yeah,
then, yeah, I'll
yeah.
share.
Just
I'll
encourage
definitely
her to
share.
come on in. Yeah,
Okay, I'll
encourage her
definitely
to
share.
come on.
Have a
Okay.
blessed day, both of you. Thank you so
You too.
much. Okay, bye bye.
You're welcome. Bye bye.
So, leave. So,
Leslie, something's going on with your mic again.
Turn itself off.
The other person said that maybe your battery was low.
Well, I mean, well, I did charge it like 6 hours ago. So.
Right now it's better. Better now. So Michelle says, which one do I buy for cataracts with directions and how long to take?
So if you're talking about what type of cataract? Is it mild, moderate, or severe?
And then AK says, how often are you live? I will listen today for info. She'll be on till tonight at 11:59 p.m. and
Yeah.
then Monday through Friday, 7 p.m. Eastern Standard Time till 8 o'clock.
Yep.
Michelle said moderate, she believes.
Okay. Then you need the 4 and I. You need the revitalize and the 4 and I. There we go. Okay. Yeah, Michelle Henderson. So moderate, definitely 4 and I.
What's the
Pixie, without me requesting a refund. I don't understand. What's the question? Pixie, come on up. I invited you up on the panel.
So did I.
Excellent.
Hello.
Hi.
Hi. What I was asking is I ordered both of those items, the C clear and the 3070, and out of nowhere I was sent a message saying that the C clear was being refunded, so I never received it. And I just received the 3070 and they sent me a different item with the 3070. So I was wondering, was the product no longer, the clear C is no longer available?
No, so the revitalize you get automatically. So you're going to get revitalized every time you order 3070, 2080, 4060, 4 and I, 4 and I 2, you're going to get the revitalize. So that's meant to be there. The C clear is made with a very specific saline solution that we have to order from out of the country. And the
Okay.
issue was that customs was holding up the order, and they were holding it up for 21 days. So we refunded everybody that purchased the C Clear until we get it in, and we should have it by Monday. And then we're going to, announce that we have it. We've already made the C Clear again, and then you can reorder it. But
Okay.
it wasn't fair to hold on to your money and wait until God knows when we were going to have the product available.
Okay. I will look for it to be in order so I can order it again. Thank you.
Excellent. You're more than welcome.
Now, see right there, that's the part that I love about you. That you just like us. You thought about people, money, and time, and energy, and what makes sense. Where do you else do you get that at? Tell me, please. Where else do you get that at? You don't.
There
Let
are places,
let's know that where.
I don't know.
Where does somebody just think outside the box and say, hey, I'm not holding up this stuff. The people are waiting on. Let's get this to them. And when we get it corrected, then we'll revisit it.
Yeah,
People
no, yeah.
appreciate you for that. You know, that's what I'm saying. Ooh, you are so blessed, baby. You are so blessed. And
Well, thank you, thank you, thank you.
I thank God that our paths crossed. Literally.
And they're gonna keep crossing.
Yeah, I'm ready. I'm ready to go to where is it? Where we going?
Portugal.
Portugal. Never knew I might be going to Portugal one day, but I'm ready.
As soon as I get this, the business settled and normalized, I'm desperate to go.
Yeah, 1738. I tried to tell her. Well, she knows it. I mean,
Thank you.
she can feel it. She can feel it.
I just feel like the right thing to do is the right thing to do.
Right, right,
And if you do it before anybody asks you, it doesn't hurt.
right. How long will I see difference in healing with the cataracts?
So it could be it could be a few days, it could be a few weeks, it could be a few months. It really just depends on how healthy your eyes are and how consistent you are using the products.
And how bad the cataracts is. Tell them how long it took you, Leslie.
Yeah, no, my left eye, the cataract in my left eye took over a year. But I was learning how to deal with the cataract at that level while, during that year. The cataract in my right eye, which was a moderate cataract, took 3 months.
All right,
So when you have a very severe cataract, there's just a certain methodology that I've learned works. You need to be able to cover the eye, a number of hours a day. You've got to use the product very regularly. Excuse me, can't stop yawning. And and you need to use the revitalize because you need to have as much moisture in the eye system as possible. So all of those things play into how quickly the cataract's going to move.
okay, Michelle said, okay, what are the directions? And then CJ, I'm gonna answer your concern in a second.
So what am I directing Michelle for?
She's the one with the cataracts, the moderate cataracts.
Okay. Then the suggestion that I'm going to make to you is that you're going to use the revitalize, and I would recommend that you do it for 3 days. So 3 full days, 5 times a day. Because cataracts actually make your eyes a little bit drier. So we want your eyes to be really hydrated and ready to rock and roll. And then you're going to start using the foreign eye. And I'm going to recommend that you do it 4 times a day for 2 weeks. Then I want you to do it 3 times a day for 3 weeks. And then we're gonna go down to twice a day for the remainder, unless you're not getting a lot of traction, and then we'll keep it at 4 times a day until you start to get traction.
All right, thank you, CJ. I went back through the comments. We do not see any of your comments. So I have invited you up. So if you would accept the invite, then you can ask the question on the panel. I went all the way back up in the questions. I don't see you anywhere. So that tells us that whatever you ask, TikTok possibly blocked your comment.
100%.
You're welcome, Michelle. So all you have to do is hit the invite. I invited you up, so all you have to do is click on it. It will bring you up on the panel, and you can go ahead and ask that question. because we're here to answer questions, not to block them or not to